call to action now. From commitment to action, the greatest danger facing Vision Zero is not disagreement with its principles. It is inaction. Many organizations have excellent safety policies. Many have safety committees, and many have procedures, training programs, and risk assessments. But the real test is what happens when production pressures increase. What happens when a deadline is missed? What happens when a worker raises a safety concern? What happens when following the safe procedure takes longer? That is where the safety culture is tested. Therefore, if we are serious about operationalizing Vision Zero, I propose 5 priorities. 1 is leadership. Safety must begin at the top. And what leaders prioritize becomes culture as well. 2, prevention. We must move from investigating harm to preventing harm. Risk assessments should not be a compliance exercise. It must be a living process that identifies hazards and ensures that effective controls are actually implemented. The best accident investigation is the accident we successfully prevented. Number 3, worker participation. Workers must have a voice. They must feel safe to report hazards. They must be encouraged to speak up. They must participate in safety discussions and risk assessments. A worker who reports a hazard is not creating a problem. They are helping us prevent one. Innovation. We must embrace technology and innovation, but intelligently. Technology should help us identify risks, communicate hazards, train workers, improve reporting and strengthen decision making, but technology should never become an end in itself. We must ask, does this innovation make me work safer? If the answer is yes, let's embrace it. But if not, let us not confuse technology with progress. Data, learning, and accountability. We need better OSH data across Africa. Our colleague, the president from Somalia, did allude to the fact that they are faced with challenges with data. It's not only a Somalia problem. If you've had opportunities to attend global and regional conferences, this is a song that is echoed all over as a challenge that Africa is still being faced with. We need better OSH data across Africa, but collecting data is not enough. We must use it to understand risks, identify trends, target interventions, and measure improvement. We must move from data simply translating into reports to having data translate into knowledge, to action, leading us to prevention. And where risks are known, accountability must follow. Inclusion is not optional. An inclusive workplace is one where safety is designed for everyone. We must ask ourselves, who is missing from our safety conversations? Are informal workers included? Are young workers adequately protected? Are women represented in safety leadership? Are persons with disabilities properly considered? Are vulnerable and migrant workers protected? Are contractors and subcontractors included? If the answer is no, then our OSH system is not yet truly inclusive. Inclusion is not an addition to safety. It's rather part of safety. Africa must own its Vision Zero journey. Africa must learn from global experience. But we must also develop solutions that are reflecting African realities. Our economies are diverse. Our informal sector is significant. Our resources and capacities vary. Our challenges are different. But Africa also has something powerful: innovation, resilience, community, and non-extraordinary capacity to solve problems in difficult circumstances. We should harness this strength. We need stronger cooperation among governments, employers, workers, the tripartite partners, professional bodies, the academia. I'm glad we have Victoria University in the room, civil society, and regional institutions. And the African community is uniquely positioned to provide a platform for this collaboration. This inaugural conference can therefore become more than an event. It can become a movement that strengthens prevention, a movement that shares knowledge, a movement that brings formal and informal workers into the OSH conversation, and a movement that places human life at the center of development. The role of the Africa Vision Zero Network. The Africa Vision Zero Network remains committed to supporting the growth of a strong prevention culture across our continent. We believe that Vision Zero should not belong to one organization. It should not belong to one country. It should not belong to one profession. Vision Zero belongs to all of us. Governments have a role. Employers have a role. Workers alike have a role. So do professional associations, training institutions, and the communities within which we live. Our greatest strength will be our ability to work together. I want to leave us with a challenge to this conference. Distinguished guests, when this conference ends, I hope we will not simply say, "That was an excellent conference." I hope we will ask ourselves, what are we going to deliberately do differently because we came here? Let every organization represented here identify one practical safety improvement it will implement. Let every country identify one way to strengthen protection for informal workers. Let every employer examine whether its leadership truly puts safety into practice. Let every safety professional ask whether workers are genuinely being heard. And let us strengthen regional collaboration so that East Africa can demonstrate what a truly preventive OSH culture can look like. Our collective promise, ladies and gentlemen, I would like to make a simple promise. We will not accept preventable harm as inevitable. We will not allow informal workers to remain invisible. We will not allow safety to become secondary to production. We will not remain silent when we see preventable risks. What shall we do then? We will listen to workers. We will learn from incidents. We will strengthen prevention, and we will continue working together. Because at the heart of Vision Zero is one simple idea: that every worker matters. Distinguished guests, Vision Zero is ultimately a choice. A choice to prevent rather than react. A choice to learn rather than blame. A choice to include rather than exclude. A choice to protect rather than compromise. It is a choice to put people at the center of development. So, let us move from awareness to action, from reaction to prevention, from policies to practice, from commitment to implementation. from isolated efforts to regional collaboration, and ultimately from Vision Zero as an aspiration to Vision Zero as a way of working. Let us build workplaces where safety is not something we remember after an accident. Let us build workplaces where prevention is part of every decision, every day. Let us build an East Africa where no worker is invisible. Let us build an Africa where economic progress and worker protection advance together. And let us remember, there is no sustainable development without safe and healthy work. There is no resilient workplace without prevention. There is no inclusive workplace if some workers are left behind. And above all, no preventable harm should ever be accepted as the price of making a living. On behalf of the Africa Vision Zero Network, I want to congratulate the Safety and Health Association of Uganda and all its partners, WASPAC, TOHASA, for convening this historic inaugural East African Community EACOSH Conference. May this conference not only inspire us, may it mobilize us and launch Vision Zero initiative. May it not only change the way we think, may it change the way we act. And may it strengthen our collective determination to ensure that every worker in every workplace, in every sector, has the opportunity to return home safe and healthy. That is our responsibility. That is our commitment. That is our Vision Zero. On behalf of Dr. Elizabeth Nkumbula, the President of the Africa Vision Zero Network, I thank you.
Thank you very much, Mr. Alex. Indeed, thank you very much for your welcome to us to move beyond compliance, to create more promotive, genuine communities where safety is implemented. You know, in Africa, we have a tendency of thanking the person who offers you a cup of tea, right? Right? But rarely do we know how that cup came to be. So at this point, I would like to thank Uganda National Oil Company for sponsoring the cup of tea. If you've enjoyed the cup of tea, please clap for them as we appreciate them. Yeah, thank you very much for raising our Thank you very much for that conversations, and I hope we have all accepted to move beyond compliance. Don't tick the box. Live through what you are ticking the box. And with that, we go to a new session that is exciting. And you all look like you have been waiting for this session. But because this session is very powerful, I want all of us to stand. Remember I said I work in global health? Yes, we want to stretch a bit. So we want to call people who are up and above us. Of you. Can we pick the back ones? Please do. Pick the back one. Yes. For a free space. Free space. Yeah, now you're ready for the session. Thank you very much.
All right, thank you very much, Alex. And also thank you very much, Lucy, for taking us through that health break. And of course, we had just had a break tea, so we needed to just be a little bit activated, not really laid back. So we are rushing through the program, and the next one is going to be the panel discussion, where we are looking at resilient OSH systems and policy frameworks, practices, experiences, and lessons learned. What have we learned from these experiences? What are the practical solutions that we're going to come about? And what are the challenges that have been coming around these challenges? So I would like to request the panel discussants. Oops, sorry. So I would like to call upon the Commissioner, Dosh, to take the seat. We have the co-chair, President, Uganda Law Society. A representative from the Uganda Law Society. They around? We are talking about OSH systems and the policy frameworks. We recently updated our OSH Act of 2006 to 2025 as amended, and one of the people that was in the middle of this whole dialogue, these whole discussions, what should be included, what shouldn't be included, how is it affecting all kinds of, workers, how are we including all workers? The framework brought about psychological safety, which is mental health, and also technological safety that now focuses on the harm that comes from non-physical challenges to technology and mental health. So it looks like we have the Commissioner. I would like to request maybe the Commissioner to sit close by. Ms. Eve Katshebe, if you could come close by as we wait on the other discussants. Yeah. Okay. All right. Let's have a representative from Uganda Breweries, SHAU, Dosh. We already have the Commissioner, Enoch, Tohasa, the representative from Roofings, WASPAC, Okay. Let's have Dosh, Kenya, to also join. All right, you can have your seats. So we are going to talk about systems and the policy influence. How best can we set them up? And I would like to start from home, from our dear Commissioner, Ms. Eve. How are these systems, the available systems, how do we connect them to the policy, and how best are these influencing the informal and formal sector?
Hello. Once again, good afternoon, ladies and gentlemen. It is a pleasure to represent the Department of Occupational Safety and Health and indeed Government of Uganda on this panel discussion. In regard to the question that you ask, the systems that we have in place and how adequate they are for addressing the challenges of occupational safety and health in the country. Well, as Government of Uganda, we have in place a number of strategies that we have laid out at the national level, and we hope that they are translating at the workplace level. We have a number of laws, the Occupational Safety and Health Act being one of them, which is really operationalizing a constitutional requirement. We have under the Constitution of Uganda an article that provides for safe, satisfactory and healthy working conditions for every Ugandan, every worker in Uganda. So we have the Occupational Safety and Health Act, which we believe to a large extent has been supporting us to ensure that the systems on occupational safety and health are actually functional in the country. But we know that it had gaps. Gaps, for example, it was not adequately covering all workplaces because it had certain provisions like requiring a workplace with 20 or more workers. So through the amendment, which we concluded last year after a 10-year journey, we closed that gap by opening up the Occupational Safety and Health Act to actually cover every workplace. So in so doing, we believe that that should cover the informal sector. I know the law in itself is not adequate because the law has to be translated into actions, specific actions, for example, inspection, enforcement. So that is where we are still, as a country, grappling to ensure that we reach all these formal and informal workplaces. But again, that gap is also going to be in some way addressed by the amendment, because through the amendment we have opened up to go beyond just the inspectors who are employed by government, but we are now looking at how can we work together with the private sector to ensure that we reach all these workplaces with the services on occupational safety and health. So with the amended act and the regulation that we are now trying to finalize for what we are calling safety and health practitioners, we should be able to render our services to both the formal and informal sectors in terms of protecting the rights of workers. That is just some of the ways that we are trying to ensure that the systems on occupational safety and health in the country are working. Thank you.
All right. Hello? 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 Okay. Thank you, Commissioner. So with protocol, I would like to go straight to Dosh, Kenya, to give us your perspective on leadership, policy influence in regards to the effect on the private, the informal sector, and the formal sector. What has DOSH Kenya done? Does it have an amended act like we have made in 2025? Or you have even more exciting stuff coming on board? Since we believe that most times we benchmarked with Kenya to see how far and then we can catch up. So, Mr. Justice, we are here to hear you out.
Thank you very much for the chance. In the Directorate of Occupational Safety and Health, Kenya, we have a government occupational or the state occupational safety and health policy which creates a roadmap. And we do have, of course, the legislation, the Occupational Safety and Health Act, together with subsidiary legislations that provide for safety and health in all workplaces. Now, the informal sector is where we have most of the problem. The formal sector, it's easy to administer, but informal sector is where we have most of the problem. And in every year, because we are now all over Kenya, in fact, we have a staff of about over 300 officers, and we have extension services where we engage professionals to carry out work on our behalf. And some of the areas that we address are the small-scale entrepreneurs. These are the juakalis, we call them juakali, the borders, and so on. So basically what we do is every year we carry out sessions of training in occupational safety and health where we highlight their hazards that they encounter in workplaces and how to go about sorting them out. We also conduct medical examinations for the small-scale entrepreneurs. Of course, these are services that they don't pay for, and to have them attend some of those sessions, we actually have got to pay them something. And in areas like training, we partner with other professionals like WASPAC, where we conduct safety and health trainings for these people. Medical examinations, we also carry out hygiene measurements, where we measure parameters that affect their work environment. But of course, as it is, small-scale entrepreneurs view OSH as an expense, and investing in such is normally an uphill task for them, but we try as much as possible because we have a law and we have a policy and subsidiary legislations, and we have staff. Again, as we turn towards the digitization and AI, it is not so much common in the small-scale entrepreneurs, but again, we try our best in achieving the best. But again, because, as I said, they command about 80% of our economy, that means that we have to do a lot to achieve the necessary safety and health because they are behind. They command the largest economy, but again, they are behind in terms of safety and health. So the very forefront that we do is training, and then followed by medical examinations. We now have mobile medical examination facilities. We have something we call an OSH mobile. It's a vehicle which has got a clinic inside and equipment, and we try to go around. But again, we are not 100% perfect in achieving OSH at the small-scale entrepreneurship. So we have a long way to go. Thank you.
All right, thank you very much. And I think the OSH mobile is something that maybe we can adapt here in Uganda to be able to decentralize, occupational health and safety inspectors and also reach to all sectors, like informal sectors, probably could come into a clinic and, well, we see how best we can reach the Muntuwa 1C, the lowest person possible within here. So to the next speaker, I would like to really talk about the practices bit of it, the experiences and lesson learned. And I would like to channel this to Mr. Herbert Ntare, who is a very seasoned occupational health and safety, one of the people that trained me in OSH at the beginning of my OSH journey, and who recently graduated in Scotland on the masters to be able to learn more and see how best he can diversify. So we want to hear from Herbert, the experiences and the lesson learned and what you have seen in Scotland that has been done differently. Mr. Herbert, the floor is yours.
Thank you, MC. As you mentioned, Herbert Ntare is my name. I work with the Uganda National Oil Company, and my greatest time has been in the oil and gas. So my experiences and lessons learned will be based on what I've seen in the oil and gas. Before I start, maybe I need to highlight that OSH, as we all know it and understand it, should not be restricted to a formal sector, but this should cut across, because it is our duty to make sure that we do not cause pain. It's our duty that, basically a moral obligation, that the people we work with, the people we use, as one speaker mentioned, should be able to go back home the way they came. So experience. One thing I've noticed is that to build a culture of OSH, it is a journey. And this journey is not a short and quick journey. It is something that you must dedicate time and patience towards in order to be able to win what we call the hearts and minds of people. When I joined one of the oil exploration companies way back in 2009, I went down the Graben. For those of you who know where Lake Albert is, where Uganda has discovered oil, and part of the regulations was that we needed to work with the local communities. So experience learned is that for that level of people that you are working with, you needed to take time, engage, explain, teach, so that they are able to appreciate why, in most cases, you are talking about things like using the right PPE, things to do with, for logistics point of view, things to do with driving within limits and speed. So it took us quite a substantial amount of time, and that's why I said it is a journey that we need to, as experts, to be patient about. And over time, this culture is built. So that is one experience. You need to have that patience that you need to instill in the people's minds and hearts in order to be compliant. In the same regard, the other experience that I picked is that most of us tend to think that coming up with lots of documents in terms of procedures, SOPs, call it, is one way of managing OSH issues. But experience has noticed that, I've picked from experience that actually the things you do practically on the ground with the people and they see with their own eyes they touch, they feel, have more impact than coming up with a whole range of 30-page manuals that people are not even going to be able to read. So what am I saying? The experience is that one-on-ones, formal engagements, using practical examples and experiences, to me, from my side, they have proven to be more effective than the other approach. Then, one other last thing I wanted to comment about in terms of experiences and what I've noticed is the issue of qualifications, academic qualifications versus skills. Today, you will have somebody come from the university. They will go and attend a number of OSH courses. They will do IOSH, NEBOSH, name it. Then tomorrow, they will come out as the experts. And I think before even those qualifications, the attainment of practical skills, being exposed to the work environment and people actually see how you physically conduct, let's say, a job safety analysis, how you physically conduct a risk assessment, and how you take it through to implementation of whatever actions coming, should be emphasized more than that kind of, issue of, I have a degree, I have a NEBOSH, I have a master's, but you have not. So, and I found this also one of the challenges in that even when you go down on the ground with such personnel, you tend to pick a number of systemic failures because of that lack of skill, that practical element that is lacking. So that is another experience I've picked, and I thought maybe I would share this with us, that it makes more sense to be practical, gain that skill, then much later you can attain the required qualifications to support your skill. Yeah, in the interest of time, maybe for now I can discuss that and hand over to the next speaker. Thank you.
All right. Thank you, Mr. Hubbard, for sharing with us your experiences. Now I would like to go to one of our big manufacturers, roofings, Mr. Frank. We would like to understand what are the experiences, what have you been able to see at these plants, and what have you learned from these experiences and incidents?
Thank you so much, facilitator. Good afternoon, everyone. Just as introduced, my name is Frank Munguleni. I work with Roofings Limited. And of course, in the manufacturing sector, there are a lot of issues that are playing up, especially in the formal industry. And from our perspective as Roofings, we feel that this conference is timely, and that the theme itself for the conference speaks a lot to the challenges many manufacturers are facing, not only Roofings as a manufacturing company. Now, I will share just a little bit of the experiences from our journey with Roofings, some of the things that we are doing, because at the end of it all, the discussions, everything we are talking about here is centered around one thing: that one worker going back home to their families safely. And that's very, very important. So allow me to share a few experiences from my journey in the manufacturing industry. One is the narrative, which is more in our different workplaces, that we treat safety as a compliance aspect, which is very, very important. So many of us in our different organizations, safety is merely a compliance aspect. We do not give it the same kind of attention that we give production, because production is the core function of that industry. So the first thing first is that involvement of leadership to give priority to safety, which the Vision Zero ambassador called leadership in action, is very, very important. in us realizing this one goal of that worker reaching back home safely. Because it does not start from the shop floor, it starts from the top. So leadership in action is very, very important. And this is an area as a company that we've worked so hard to achieve. Commitment from the top, where our leaders are involved. It starts from the policies that we make at the top. What are our commitments in terms of safety and health and well-being of our workers? And that's very, very important. So leadership in action, for me, is one of the experiences that I would like to share in moving this journey, ensuring that every worker reaches safely at home every day after their day's work. It's not a crime that they have to go to work, and it shouldn't be a reason why then they do not get back to their families safely. So that is one experience that I would like to share. And then along the same line, when we talk about leadership in action, one other thing that I just wanted to add is the issue of policies. When we go to our different organizations, we all have those different policies that we even frame and signed by the top management, put in those different places. The big question is, do our policies reflect the practice on the shop floors? Or do our policies reflect the way we do the work that we are doing? Do our commitments in those policies, are they actually being implemented at the various levels where work happens? Because a good policy is as good as the implementation. A very good policy drafted, signed, and filed or put up displayed, when not implemented right or to the dot of what it says, then it does not help in any way. So even as leaders, the top must be able to hold accountability on the different commitments that have been given on the policies. If we have a health and safety policy, what are our commitments to our workers to see that these people are able to get back home to their families safely? And when we put this policy into practice and we hold each other accountable for it, then for me that is leadership in action. And I believe that gives a good background to where we can move this journey forward.
Right.
Secondly, is the issue of design of safe systems of work. Of course, every manufacturing industry, there are a lot of things that we deal with. Now, the question is, are our systems designed in a way that they protect the people who use, whether it's an equipment, the way we are supposed to do the work, are they designed in a way that it's safe for them to do so? So it doesn't start from the accident happening, it starts from the planning stage, the designs. Do our systems allow our people to work safely? And that's very, very important. And also those questions come with a lot of investments. And it goes back to the first point of leadership in action, because investment decisions are made at the highest levels. So if leadership is not involved, then we will not be able to design safe systems of work that can then ensure that every worker who comes to work is able to go back safe to their families at the end of their shift or at the end of their work. And so that is very, very important. So collectively, we must all focus on designing systems that are safe, instead of focusing on behavior of people, which is important, but we must be able to design systems that are safe for people to use. And in the design of systems, one experience that I just wanted to share is that in about 2023, as a company Roofings, we took a step that we wanted to reach that milestone of also zero harm, because we believe it's a right that every worker should be able to come to work and go back home safely. So when we sat down at the leadership level, drafted the strategy and the guidelines of how we could reach that journey, 1 year down the road when we were implementing this strategy, we realized there was a big disconnect between what we wanted to achieve at the higher level and what was actually happening at the level. And the bigger gap was that when we were doing the strategy or the planning, there was less involvement of the people whom we were actually trying to put a strategy to protect. So worker involvement and participation is something that is very, very key in achieving this goal that we are talking about, that has gathered us all here today. When you're designing safe systems of work, we are not designing these systems for imaginary people. We are designing these systems for real people who are going to have to use these systems to get the work done. And therefore, it is right to incorporate them and obtain their views, involve them in designing these systems, because systems designed without the people that are intended for then may only go as far as on paper, because involvement and buy-in is key when you're trying to do this. It's not necessarily about the enforcement, but when people feel involved and when people feel part of something, it definitely will make them become part of it and they'll collectively do it. So in our second year, when we're implementing the Vision Zero agenda or the Zero Harm agenda, we changed a little bit. We had to go down to the teams. We had to understand zero harm didn't mean anything to them. It was just a goal that the company wanted to achieve. That's what they perceived it as. Now, what meant more to them when we went down and interacted and involved them a lot was actually the fact that for them, it's going back home safely that is more important than not having the accident. So, same thing, but in two different ways. So whereas we looked at the Zero Harm agenda for them getting back home safely was what they focused on. So we introduced something very simple, just a mindset change. We called it Your Family Needs You. You're the best gift you can ever give to them. So that in line changed the narrative of how they looked at safety. Initially, they thought about safety as something the company was forcing them to do, whereas when we changed that narrative, the mindset shift to looking at it as something that actually you're not doing this for the company, whereas the company wants you safe, your family is out there at home waiting for you. So it's important that we all have to play our part, do our duties to ensure that we then get back home to our families safely. And that was very, very important for us.
Right,
and
Frank.
then lastly, just to finish with, is the decisions that we talked about. We are discussing us for formal and informal sector. Now, I do not know how many of us in the room are basically coming from the informal sector, but if we did a quick survey by show of hand, we would realize that there are very less people in here in the room from the informal sector. Now, the informal sector is not just a problem to the informal sector. The informal sector is also an issue for the formal sector. Let me just finish with that. When we started doing data-driven analysis, we realized we lost more, or we had more accidents of our workers on the roads while coming to work than actually they happened at the workplace. Which meant that we were suffering more from the challenges from the informal sector affecting us, our operations, and our everything, causing harm to our people, whereas this was coming from the outsides of our daily operations. And so that is very, very important. So the bigger question then for me is, how do all of us contribute to ensure that we can have a message reach to the informal sector? Employees use the roads, either it's the public means or the border, and they are getting accidents there. How can we call our people to create awareness on what basics can they use on the roads? Because this one person will go speak to the next border they are going to take and drive that awareness. So how can we all collectively reach to the informal sector? Thank you so much.
All right. Thank you very much, Frank. And we have learned the best experiences and the lesson learned and what it has been done about. He has highlighted one big factor, which is investor buy-in, top management buy-in. The moment you have the top management buy-in, investor buy-in, then occupational health and safety practices become easier. Then the other one that is very key is mindset change. Mindset change and culture integration. You know, we are enforcing. We are not actually changing the minds. We are not actually transforming these people. The perspective of it's not about work, it's about your family. I think that's a very, very great one from Roofings. And I think it's very much intrigues all of us. It's not really about this work. It's not about bringing problems for the company, but I could also cause problems for my family. Those are very, very key takeaways from my end. And I believe you got so many takeaways on your side as well. So listening in to the experiences and lesson learned from UBL, I would like to listen from Joseph Tindiebwa to give us a preamble on what UBL is pushing. And also UBL is one of the organizations here in Uganda that has been so much respected with OSH culture, where an HSC manager is actually respected. But we are going to hear much more from Joseph to give us really what's on the ground.
Thank you very much, Master of Ceremonies. Joseph is my name. Joseph Tindiewa is my name. UBL is a manufacturing plant. We all know that, except possibly our colleagues from Kenya and Tanzania. And not different from Roofings, I'll just speak on maybe about 3 or 4 experiences which I'll express in terms of how we manage our health and safety in a way that everyone understands and appreciates. So we've talked about leadership commitment, and as everyone has mentioned, it is very critical in the management of our health and safety systems at UBL. But the emphasis for us is actually in participation. The appearance of the commitment of the leaders by the floor workers, how do they appreciate that commitment? It doesn't only keep on paper, it moves from paper to the shop floor. And how is this done? 2 or 3 things. One, on a weekly basis, okay, we have 3 layers of management: top leadership, middle management, and then our lower level of management. So on a weekly basis, we have a leadership walkabout in our shop floor sections, and this does not come in on, say, a whole plant session every week. In a particular day, that is a Tuesday, we pick a section, we go in, all of us, and we look at or experience what are those challenges that our floor workers are faced with on a daily basis. When someone approaches you as their manager or as their health and safety manager, and they are talking about a collapsing platform, have you been there to experience what impact such a collapsing platform has on their lives? So that moves away the commitment from paper, where we sign, say, a statement of commitment, to engagement with our floor workers. And they see, when they are sharing with us experiences, we also appreciate what that impact has in terms of health and safety. The second one, in terms of leadership commitment, is the availability of resources in terms of awarding innovations that are related to health and safety, and particularly leveraging on technology improvement. So in a hierarchy of controls, we all know that elimination, substitution, and engineering controls form the best 3, and then the other 2 come last. So most of our awards in terms of health and safety performance or innovations, which we commit to very much, are into that aspect. On a monthly basis, we do that, award every employee, that brings on board an innovation that improves the health and safety aspect, small as it is very much recognized. And this is just not part of, this is not only for the UBL staff, but it also cuts across to contractors who we work with on a daily basis. So for leadership commitment, I can highlight those two. Let me speak something about how our floor workers appreciate health and safety to properly understand that a decision taken today and in a second can either save a life or can actually destroy your life. So our structure for health and safety is not led by myself, who is the health and safety manager. No. I am there to provide guidance, expertise, and advice where things possibly need a higher hand. So through our hierarchy or our levels of management, at every level, there is a safety champion. We have a safety champion amongst the top leaders. We have a safety champion amongst the managers. We have a safety champion in every section of UBL. And I'm emphasizing contractors, inclusive. Contractors are very much part of our system because they actually they belong more to the informal sector when you compare them with the UBL staff or structure. So the contractors, for them, we give them much more attention in terms of what are they developing. So what the champions do for us is they are our eyes, ears, and our leaders in those areas. Every submission that comes through, either as a safety concern, a safety appreciation, a safety challenge, leading the risk assessments, reporting of hazards through our reporting platform, all is championed through the safety champion. Ensuring that everyone has PPE every morning before they go to work, that is their duty. Ensuring that no job is done, especially the non-routine jobs to be done without a proper risk assessment done, that is their job. So what that actually does for us is, instead of someone fearing to speak to me about a safety concern, they are very much, it is easy for them to go and approach their safety champion, discuss the matters, and in our safety committees, the matters are raised, they are followed up systematically to make sure that everything that has been raised is actually closed. And lastly, that is similar to what I raised in terms of technology. In my point number one, is that we leverage very much on technology. The world is moving. I think on a daily basis, a new innovation is coming on board, and we don't want to be left behind in terms of technology use. So our health and safety systems, most of them, they are also reliant on technology. In particular, the investment that goes into processes. A manufacturing plant is a closed, complex system. So we make sure that there is less interaction of the man or the human with the system. The system actually controls itself, relying on high-level technology, to the fact that if there is any precursor suggesting that something is going amiss or a fault, it is able to trigger an alarm, and then do the preventive approaches before an occurrence that leads into fatality or a major incident occurs. Otherwise, challenges may be similar across board, but we keep in striving day in and day out. And when you look at the manufacturing plant and then you compare it with our distribution structure, in the distribution structure, we are faced with much more of the informal business operations compared to when you come to the site on the plant. My colleague in roofing just talked about setting up safety systems and arrangements. You will come to the plant. When you enter, it will speak even before I come to you or a security guard does a safety induction for you. So that already, even when you are not used to that environment, it creates a mindset change that the place I'm walking into is not exactly where I am coming from. But when you cross to our distribution centers where we are dealing with distribution partners, or what we usually call distributors, the challenges of the informal sector are actually eminent. Our effort into that is that we extend our knowledge from what we do in manufacturing and coach, build the capabilities of the distributors and their staff across all aspects of health and safety, so that we do not need to be with our knowledge alone, but it is shared across and in bits that can easily be taken in and easily appreciated by the staff. Thank you very much, moderator.
All right, thank you. Thank you very much, Joseph, for highlighting that. And maybe one of the key things that I could keep, that I picked from his presentation was they took safety beyond management. They took safety beyond management. Everybody is mindful of occupational health and safety hazards. They can react, they can act on it. Yeah, as he mentioned, he is to offer guidance where there is a new niche or where there is a challenge, but he's not there to direct, enforce, and push and pull people to do health and safety. He has decided to decentralize. Yeah, you'll be able to decide to decentralize and ensure that every worker at the workspace, at the plant, is aware of these health and safety challenges, which has, I believe, made his work much more easier, trackable, and implementable. Thank you very much, Joseph, for giving us that from UBL. And let's cross over to our neighbors, Tanzania. I would like to listen from Nation to tell us what you've already experienced in Tanzania. How is implementation? What are the experiences? What have you learned and developed in Tanzania in regards to occupational health and safety?
Yeah, thank you very much. My name is Nation Mudara, the Executive Director for the International Institute of Safety Culture, based in Dar es Salaam, Tanzania. And I'm supporting TOHASA as EXCO member, and I'm running the strategy and planning team. So what I will share today, basically, I'm not the spoke for DOSH or OSHA Tanzania. I'm not representing them, but it's like overview as a normal OHS practitioner in the country. So I would like to start with basically sharing how we are legally structured in terms of the legislative structure. So we were well set in terms of the OHS Act and the number of regulations coming up, all founded with the OHS policy that also started in the number of years. And all of these have been into practice. Also backed up with the Employment and Labor Relations Act of 2003 and 4, which is also backing up with a number of provisions to support OHS implementation. And the good thing is also OSHA, who is our authority, is also part of the tools of the Ministry of Labor. And this is also added to some of the sector-specific attributes, things like the atomic energy agencies, all those have got the likes of the legislation, chemical handling, and the like. So the other part is, I will talk is more about the industrial delivery, which is more of how are we supporting the existing legislation to put into practice. So OSHA himself, they are really doing a good job. I would commend for that. Despite of the small number of inspectors that is outpaced by the increased number of workplaces, but their inspections, medical examination, training over the past decades have made tremendous impact to the workplaces, to be honest. And TOHASA, plus the rest of the private, though not formalized, private consultants, training expertise, they form a valuable ecosystem in not running parallel to OSHA agenda, but adding effort towards streamlining the OSHA priorities. So, for example, with the existence of TOASA, regardless that we are still young, we have seen a lot of awareness being raised among the OSHA professionals, even discovering the talents which have been hidden, even knowing that how many are we in terms of the number, because before TOASA, it was not easy to trace who is employed where and doing what. So the way that either the registered or non-registered OHS professionals, I would say in a number we are almost approaching, and this is not informal, this is according to my own informal research, we are approaching to 5,000 professionals really recognized and really working. So all of these are adding impact. Some of them are even went further to go to the social media awareness touching different sectors. And also WCF, which is Workman Compensation Fund, is now, I like the way they're not, as a normal compensation fund, we're expecting them to be more reactive. But they went further extra to be more proactive. They are supporting a lot of proactive initiative done by all sectors. They are part of the core national promotion agenda and et cetera, et cetera. We have other associations like environmental health practitioners and the industrial hygienists registered membership and associations. All of these are coming up to bring the agenda, and we're working together to ensure everything is now into practice. Maybe the other part that we'll share is, again, the Tanzania experience and some of the lessons, like what is really happening. So I would recommend, again, the active enforcement, regardless of the number, that we can still say it is inadequate. But at least for the formal sector, we can still sense the ownership that the authority have in terms of enforcement. And we are still having a challenge to the informal sector, and I like the approach that OSHA is using. So for us, from registration, we have two different categories. So all the entrepreneurs and the SMEs, they have different channel of registering and the way they should comply. Basically, through the Department of Training, Research and Promotion of the OSHA, they have an approach of more promotion rather than enforcement. I think even in the 5 years currently structured, the informal sector is not even in the category of being enforced, rather than being empowered, and sensitization is one of the key priorities. So there is that set of separate way of enforcing compliance across these two sectors. And as I said, we have a mature professional setup that is well established through the ecosystem of the TOHASA and the like. The government is still, which is also done by OSHA, is using the tri-parties way of approach by means of engagement. So the government is still front in terms of giving the guidelines. We have the employer engagement. Basically, OSHA is coordinating regular stakeholders meetings so that every employer will always attend to share their views, and also the employees also being part of this circle. One more interesting, which I would say the rest of the formal sectors are doing, just to back up whatever OSHA is doing, is those big organizations which have already mature safety culture, like in the mining, some of the telecom sectors, some of the manufacturing companies. There is a big rise of ownership in terms of safety. As a matter of fact, if we go to these individual organizations, you find there is a very strong contractors management system, whereas in fact they're doubling the effect that OSHA is doing. First of all, those contractors, they're already registered with the OSHA, and they're meeting the OSHA annual compliance license requirement. And in addition, that being one of the pre-qualification requirement, these organizations are already going further to do intensive audit and monitoring to whatever is being done. We believe, because this cannot be the single unit effort, with this being intensified, we're going to reach even the informal sectors and having everyone even working safe. So otherwise, the rest of the challenges is like the rest have said, but The informal sector is still one of the key focus that everyone needs to come. And I'm looking forward to see SHAU, OSHA, SHAU, TOASA, and WISPAC in Kenya to come with a strategy instead of just speaking here. We all understand we have recognized. We need to come with strategy on how we engage, even how do we work with the government to come with tangible action that we can bring them into perspective. Thank you.
All right, thank you very much, Nation. And of course, if you have not heard it really well, is that they take ownership of these challenges. They accept that these are the things that could affect our businesses, these are the things that can affect our growth as a country and as a company and an individual, and so they take ownership. In so many cases, we have been able to make, due diligence or root cause analysis a blame game, which is something that really shouldn't be an HSC practice. We should find the root causes without bias, without pushing onto the other, but seeing how best we can correct, these challenges, how best we can correct these mistakes without playing a blame game, but then building the capacity. Instead of blaming someone and firing them, how about you find out the root cause and you cover it with a capacity building initiative? So I think that's a very, very big takeaways. So as we come to the last parts of this session, I would like to ask the government representatives. You have heard from the private sector. They have talked about the challenges. They have talked about the experiences. They have talked about the lesson learned. Now, I will bring it to you, Dosh, both Kenya and Uganda. I will start with Kenya. What have you been able to pick here that you could, add into the policy, into the system, and be able to improve or support these organizations that are trying to push a safety culture? So from their submissions, what support can you render? What policy influence are you looking at to support or to eliminate these challenges being faced by the private sector? I will start with Mr. Justice.
Thank you very much for the question. This is a very important forum, and I've been able to pick quite a number of items that we can implement to bring up the informal sector in terms of occupational safety and health. One is that, as my colleague from Tanzania said, is to own up. As a government, we should be able to own up that this informal sector is ours, and they equally need the occupational safety and health services, just like the formal sector. So that is one thing that we will have to own up. Another thing is that we have to create some form of incentives. The informal sector is one sector where one worker leaves the house in the morning and is not sure that he will make anything during the day. So he will tend to put aside anything else, safety issues, health issues, and ensure that he will do everything despite the conditions to ensure that he takes something home. So let us create some kind of incentives. In Kenya, we try by inviting these people to a training session. Of course, that is a benefit to them, but that view and that mentality that they are going to make something is out of their mind when you call them to a forum like this. So an incentive that you can create for them is like awarding those ones who are best performing. At times we do pay them when we call them to a forum, a training like this one. We have to refund to them the approximate amount that they are meant to make in that day, so that they don't see that they came to a forum like this one just to come and waste their time. So on top of the gain they get from the training, they are able to go home with something. So an incentive can do quite a bit. And then let us also prioritize some of these entrepreneurs, because we have tended as governments to always give priority to formal sector and leaving alone the informal sector. And yet, when we look at the informal sector, like in my country, the informal sector drives 80% of the economy, but they are 80% deficient in terms of OSH services. So let us put them on the forefront with a mind that these are the people who are driving our economy, and they are very important in what they do. Even if they do very small business here and there, cumulatively, they drive a very big wheel of our economy. So it is very important. And the manner, lastly, the manner in which we enforce and administer our laws and policies against the informal sector should have a different approach. That let us not apply the law in a manner that it's going to make them even hate the practitioners or the enforcers of the law. They should be able to have that culture themselves, that safety and health is for their good and not where they are being policed around or they are forced to do something. You know, you will wonder why maybe a border rider, only when he knows that there is a policeman ahead is when he's going to wear a helmet. Let it be a culture for that person to wear that helmet, knowing that it is for his safety. So training, incentives, and owning up is very key in this respect. Thank you very much.
Thank you very much. We just go straight to Ms. Eve. Tell us the perspective on what she has picked, what can be added to the DOSH department, and what is going to be the focus. What are your takeaways that can influence policy? Because we are talking about systems and policy. So we want to know what are the systems, what are the challenges, and what could we take away, or what our government has taken away to be able to be added and to be supportive to the occupational health and safety sector in Uganda.
All right, thank you so much. First of all, before I say my key takeaways, I would like to thank the representatives here of the private sector for all that you have shared with us, because I have seen that there's a lot going on. I know as an inspectorate, we have been in touch with your workplaces, but there are certain details that we had not been able to pick. I appreciate what is going on in terms of engaging the workers, in terms of making sure that everybody feels like they are part of the problem and part of the solution. I also liked what our colleagues in the region are doing in promoting safety and health. So really there is something for us to learn as a country and as a department. First of all, from all the all the issues that have been presented here, one key thing that I pick is the issue of the leadership in action. So for us as a department and as a ministry, we are going to really try to show the strength of the leaders in supporting this cause. We are going to continue to engage both our political and technical leadership so that they are seen in the country to be pushing for this occupational safety and health in the country, because I know that makes a very big difference. Interestingly, the lessons that have been picked by my colleague from Kenya are quite similar, because I realized that we need to change the narrative, which was also mentioned by one of the people that talked about what they are doing. In order for us to achieve this mindset shift that we want, we should not stop, we should stop trying to be the policeman or trying to be the one that is trying to identify problems. Change the narrative and try to show people that this cause is actually for your good. So as government, we need to reframe our message, because we know that safety and health is for everybody's good, but many times we are looked at as the enemy instead of as somebody who is actually helping the workforce. So for me, I feel like as government, we need to find a better way to send out the message out there for people to be able to comply with the requirements of the law. My colleague also talked about the reward system. It is something that I had also picked as one of the ways, because we always talk about weak enforcement as one of our challenges. So in essence, we are not recognizing the fact that it's actually important to also recognize good performance. So I feel like one of the things that we need to do more of as government is to actually reward the people who are doing a good job, both in formal and informal sector. Because if we actually recognize those who have taken a step, maybe improved from where they were to where they are now, it will encourage others. And I know as Uganda we have tried through the OSH Awards. I know it is not yet as big as we would want it to be, but I know this is one of the ways in which we can actually encourage people to be more compliant. For us as a country, really, our priorities are more awareness out there. The information needs to be out there, but now it's not just putting information out there, but what kind of packaging are we putting it in so that people can consume it positively as we would want them to. Like we would want people to take up issues of self-audits and self-regulation that we have seen working in some of the bigger workplaces. So we shall continue to push for that. Of course, professionalizing the practice is one of our biggest priorities as a country, because we know there are many people who are doing occupational safety and health work out there, but we would like to know that they are doing a good job and doing it right. So that is one of our key priorities as a country. And of course, capacity building, not just for the inspectorate, but capacity across board. So it is one of the key priority areas that I see us focusing on as a country going forward. And maybe just my message is that it is something that I thought about as they were talking the various speakers. Many times we do things just because the law says that we should do them, but through the mindset shift that we have been talking about through the panel discussion, it's important for us to start doing things because it is the right thing to do, not because the law says that we should do it. I thank you.
Thank you very much. What we have been listening in was what the government had in hand, what the government has been doing, what it has already done, and what's keeping on to do. And then we went on to the private sector, discussing the actual matters that they're facing, the experiences, and what they have been able, to come around to be able to go over these challenges. And then also we have concluded with what the government has actually learned from these perspectives, from these challenges, from this information. So we are here, all of us, to learn. The government is here to also listen to you. Mr. Justice mentioned something very, very important. We are not just coming here to have discussions, but we are coming here to learn and see how best we can impact our countries, our companies, and our individual lifestyle. So now to continue and actually go on and listen in and be able to understand that we have all been understood, I would like to take this opportunity to call upon members of the audience, at least 5, to give us a few questions or what they have really got from this sector, or what they have taken away, or what more burning question, something you think it has not been spoken about, something you think the government should do, something that you would want to understand more from UBL, UNOC, what they have been practicing. So please, the floor is yours. My colleague will be bringing you the microphone so that you can submit your questions. I think we have one on this other side. It's on. Yeah.
As we start.
It's on. It's on.
As we start the Q&A, a bit of guidance that we have done enough. Thank you very, very much to the panelists. And my request is, remember the way we do safety comms? They're usually short, clear, precise, right? So my request to you is, one, state your name. Don't say the thank you. We have already said on your behalf. So what we need you to do is to say your name, where you work, and the question. If you're directing to a specific panelist, please tell them, they'll be writing down. We will take the first 5 questions. Whoever has the other mic can help so that we have 2 roaming mics.
Short and precise, Christopher, Speedbird Advisory. So my question goes to first the gentleman from UNOC. In 2023, there was an incident, an OSHA accident at the Kingfisher project, and it led to the halt of operations by the Petroleum Authority. And I'm wondering, how is UNOC leveraging emerging technologies to achieve or enforce the culture of occupational health? Then the next question goes to UBL. Automation of occupational health leads to, automation of operations in a factory tends to decrease human judgment, which at some point leads to safety issues. I'm wondering, how are you trying to ensure that human judgment is not compromised by automating your systems? Then the last question is still to UBL. How are you incentivizing occupational health and safety to contractors?
Okay, the next question. Let it be interactive. At least we have been listening. We should have a few kickbacks.
Okay, thank you so much. I'll also be brief. So my name is Trevor Tukiko. I'm from Kenya. I work as a compliance officer. So my question is for the panelists, all of them. So I won't be specified on so and so. So the first question is, if we check the systems that we have, mostly they're for the formal sector. So my question is, how can we have the informal sector design that can now accommodate everyone and each one of them? And then another question is, we are talking about the leadership and action. So I was asking, what does effective leadership looks like in an informal sector where there is no HR, there is no safety officer, there is no budget for the safety? And then as I finish, I also have the top-ups. The people who were talking, the panelists, they had very, very good insights. So I wanted to also add on the informal sector. They were talking about how they can enforce them in terms of system designing. So for the informal sector, how to approach them is like we move from the enforcement to the approach of educating them and supporting them in a way that we first identify the risks that are there, and then we educate, we support, we improve is when we enforce. But the moment we begin with the enforcement, then we'll be doing a zero work. So as I finish also, I want also to support my brother from the roofing. You talked about the designing of the system in terms of the formal sector. So for the formal sector, it's at least, it has a design that you can see and you can also work with. But for the informal sector, it's somehow ambiguous and we can't even base in each and specific one. So all the panelists that are there, so maybe if you can give us a guiding principle on how to make a designing system that can cut across all of them, since I understand that in Kenya, most of the legal things that we have, I mean the legal compliance that are there, it's based mainly on the formal sector. If you check the OSH Act 207, it only talks about the formal sector, and it doesn't include the informal sector. So maybe if you can give us a clear approach on how we can try to integrate the both system for the informal and the formal so that we can have a good and working system. Otherwise, thank you.
Thank you very much. This only shows me how much attentive you all were. The fact that people are flipping pages, people have been writing down, people have been learning, And to me, this is what I call a great discussion, an impactful discussion, where people write down, they have their thoughts, they have their curiosities, and they are willing to share and learn more from the people who have spoken. What is the next question?
The next question is from Celestine Muhumuza. I come from Wakiso district, and I work as a senior labor officer. My concern, I wanted to these different countries who are here to share with us on how they enforce compliance to the labor laws of their different countries. As brief as that.
Thank you very much. I wish the next ones can also be as. But we are here to learn, so you can express yourself as well.
Thank you very much. My name is Michael Tengeka. I work for OSH Uganda. And my question goes to OSH Kenya. There is something he spoke which triggered my mind. He said they conduct medical examinations for the informal sector. And I wanted him to elaborate more how. He talked of the mobile clinics. And what came to my mind, I just imagined, I think the government of Kenya is very rich. I would want to know how practical is that, how you're doing it, so that we can pick a leaf. Then my second question is, you talked of doing trainings for the informal sectors. Yes, have you also concentrated, that basically covers the mindset change, but have you also quantified the behavior change, the impact it has created? Because many times we tend to concentrate on the mindset change and we don't focus on the behavior change. Then, the other thing I can talk about still in regard to the informal sector, have you also done some bylaws for the local community to see how the informal sector is covered? And finally, have you come up with a method or a tool to ensure that safety and health in the informal sector is covered? I will give an example, like for CLTS is a tool which they use to get rid of open defecation. Has Kenya come up with a method to ensure that there is compliance to OSH in the informal sector? I submit.
As we are closing up the question, I want to give the last question to a lady. They have been very quiet in the room. Be blessed as you represent
All right.
us.
That was intergovernment knowledge sharing.
Okay, my name is Maska Idris. I'm the HSC officer, Bugoye Hydro Limited, under Berkeley Energy. I work with the energy sector, Bugoye Hydro. So my question goes to our panelists and probably anyone, especially those in the energy sector. We are looking at the formal and informal economies, but now my question is geared towards the communities around our entities. Not necessarily the border men, but that school-going child that is just passing near your structures. What mechanisms have any of us in here put in place beyond the usual community sensitizations and stakeholder engagements? What mechanisms have we put in place to protect the communities neighboring our structures, our companies, to protect them and ensure that they also pick up the OSH culture within them? Because it's one thing to do the sensitization and it's 1 week down the road and you're having an incident with just a community member who was walking by. Thank you so much.
Thank you very much. And this brings me to the few challenges, actually, to the few questions that I got. When we were doing a sensitization in Western Uganda, and we were interacting with different workers, informal sector, asking them about occupational health and safety. One of the very most interesting response was, we thought those things are for people in the city. Yeah, that question really hurt me because so many industries are upcountry are out there. So if someone that side is thinking that OSH is a privilege to someone in the city, is really a long way to go. And also when we were doing it within the city in Kampala, and most, I can tell you, they will be like, you mean OSH is that much seriously enforced? You mean there is a person that runs, you know, a whole department on occupational health and safety? We thought maybe it's an HR role. And others can even go ahead, that's a Western culture kind of thing. Yeah, those are bazungu, we call them bazungu. That's like bazungu stuff. Are we not allowed to live and work healthier or in safe environment? Is it really a privilege or it's a fundamental right as by ILO 2022? So we have had the questions. We start from the first one. You've been noting. The first questions, I think, they came around UNOC, the experience that happened in the Kingfisher, and maybe the other one was UBL in automation. But of course you are writing, so we shall go question by question to those who were being given the questions. So we start with the first question. I think it was about the experience in Kingfisher.
Okay, thank you. Maybe before I dive into that, give you the answer, we need to first understand how us as UNOC, SINOC that operates Kingfisher, and Total that operates in Tilenga, how we work together. So UNOC has got a 15% stake in Kingfisher, for example. And Kingfisher is operated by SINOC. So we are partners. And UNOC primarily looks at the commercial side of things. We are not regulators. We are also regulated by Petroleum Authority. So basically, when such an incident occurs, the operator takes charge, shares the report, we discuss lessons learned, and as partners, we have the mandate to approve or disapprove. So from the HSE point of view, the incident referred to was investigated, a report shared with us, the partners, we discussed it. We normally have weekly reports that come in that review. We have quarterly engagements that we also do among us as partners and also the regulator, which is the Petroleum Authority of Uganda. So, as far as that incident is concerned, it was shared with the partners, we reviewed it, corrective actions put in place, we are satisfied, endorsed, and we left it to SINOC to implement. But that does not mean that we kept our eyes closed. We picked lessons of which form part of our goals towards managing safety and incidents in the workplace. I hope that satisfies you. Maybe before I end, there's a lady from Energy, maybe be also being part of the Energy.
Yeah.
I could give a bit of what we do. You talked about communities. We are aware that our social license to operate where we operate in the communities is in the hands of the communities in which we work with. So a number of initiatives have been taken from UNOC side, and maybe I can also talk on behalf of our partners. Things like land transportation safety. We've had teams go to the communities, created awareness, provided safety wear, such as helmets to border riders, reflectors. From the health point of view, we've engaged other government bodies like TASO and others to go to the communities, talk about HIV, all infectious diseases, provide counseling, provide treatment, and all that. So that is part of the bigger package of the social performance that we do within the communities. At the beginning, I mentioned how we went into Bulisa. Imagine the people in Bulisa we found, but by the time we were almost 3, 4, 5 years in the operation, even the person that had never gone to school that was within our operations at least appreciated the fact that they needed to work with full PPE that is appropriate. They knew they would not partake in any activity unless a toolbox talk has been held, instructions given, and a way of how they operate. And I can tell you, in the many years that came, we started registering so many man-hours without injuries, because we went and penetrated the hearts and minds of the people, even if you would categorize them as people who are not literate. So that worked, and this has continuously been done. Also, some of you have been noticing that we do hold what we call supplier development forums. And these at times are even very specific to HSC. We bring in communities, contractors, and we put down our expectations and how they're expected to operate. Thank you.
All right, to just be quick on, maybe I will start with Mr. Justus as we come this side. So Mr. Justus, I believe you had a question from our DOSH department here in Uganda, and that's why we are here. It's not just interpersonal, it's not just intercompany, but also intergovernment sharing. And to me, these are the questions that we really need to hear, and the responses we ought to really, we look forward to. So Mr. Justus, what can be done on our end, or how have you achieved the clinics and the whatnots that you are putting forward?
Thank you very much, Chair, for that question. I will tackle a number of questions. One was by Celestine Gunza, the labor officer.
Could you get your mic close, maybe?
Yes, one was by Celestine, how we enforce our laws in our country. Of course, number one, our country is divided into what we call counties. We have 47 counties, and under those counties, there are sub-counties. So you will have a county with several sub-counties. Now, in each of those counties, we have officers of government who are staff of the Ministry of Labor and Social Protection. We also have occupational safety and health officers who are heading the counties and staff under them. Each of those have got targets and work plans for every year. So normally, every officer is supposed to execute his target, and this is executable in accordance to the provisions of the law. So they go to workplaces, inspect. In the event that they find any contraventions, then they involve the Office of the Public Prosecutions for enforcement and court procedure. But most cases, what they do is inspections, and from the inspections, they are able to do reports and recommendations which are adhered to by those workplaces. That is how we do our enforcement of our laws. All the labor laws, including Occupational Safety and Health Act. And there was a question about the informal sector who do not have a setup. They don't have HR, they don't have management, they are self-employed. What we have done in Kenya is we have encouraged those informal sector entrepreneurs to form groups. Matatus, the transport vehicles normally have what we call SACCOs. It is also common with border borders. So you will have border borders who work around Imperial Royal Hotel, forming their own group. Another one of another region like that. So all over the country we have those ones. And those groups are registered under their ministry. There is a ministry for transport, there is a ministry for cooperatives where they register, and those are the ones we target as the Directorate of Occupational Safety and Health. We register them, And after registration, they have their own mechanism. They have their own leadership. Now, when we want to do occupational safety and health services like medical examination, then we can organize with the representatives of each of those groups and then have medical examinations done in a structured way. So the only way that we can reach them is by them having groups. I realize we have so many borders here. In fact, they could be millions. The only way that we can reach them and give them occupational safety and health services is having them being in a certain arrangement where we have groups, and then from those groups we can execute medical examinations. We can be able to disseminate information by inviting key people. In Kenya, we have what we call occupational safety and health committees. They form committees, and that one is provided for in the law. So once they form those committees, we train the committees, and those are now the champions of their groups. They go disseminating the same information to the various members in those groups. And then there was the issue of whether the trainings we conduct to the informal sector, whether they have been able to have an impact on their behavior. Of course, this is a balance between somebody's earning for his family in a day and what he is going to receive as a training. So what normally happens is that there is an impact. There is an impact in terms of behavior, but that impact is not as we could expect. It's not something that happens in the formal sector. In the formal sector, you can easily see that impact. But the informal sector is normally very gradual, and it is quite slow. So the impact is really there, only that it is gradual and not as fast as we could expect. As to whether we have bylaws at the local level, we have the national law for the occupational safety and health. In fact, it is similar for all the countries in East Africa, the Occupational Safety and Health Act. And then we have regulations under that. At the same time, we also have, in the event of an accident, there is a Work Injury Benefits Act. In Tanzania, they have WCF. We have a similar framework, and this is what applies in the entire country. You could be having the local governments, those are the administrative structures of the counties, having their own small bylaws which relate to safety and health. But we are very keen not to have duplication. So when they are making such bylaws at the county level, it is ensured that they don't conflict with the national occupational safety and health laws. The kind of laws they can create are those bylaws whereby they are going to synergize what the Directorate of Occupational Safety and Health Services is offering. Thank you very much.
Okay, thank you very much. I hope the people that put up questions on this have been able to pick. Our DOSH department probably also been able to pick a word or two in the things that you were asked for. We go on to Mr. Frank. What are the questions that were directed to you, and what are the responses?
All right, thank you. I will just speak or add my voice on two questions that were raised. One was basically about how can we accommodate the informal sector into these kinds of discussions. I think for me, just like my colleague from UBL talked about, the formal sector does not operate in a silo alone. In the formal sector, there's a dotted line of engagement we all have with the informal sector. Be it on the contractor basis, most of these contractors that we deal with are a bit informal. Be it the distributor basis, most of the distributors that we deal with are a bit informal. So it's important that we try to bring them on board onto the same safety systems that you're building for your organizations. Involve them in the same. Now, for example, I will just talk about something small that we do at Roofings. One of the things that we do at Roofings is we hold barazas. This is where we reach out to the last people who use our products. And these are mainly the masons, the carpenters, most of these construction industry players at the lowest level. And majority of these people are in the informal sectors. Even though we reach to them basically to talk to them about our different products, one of the issues that we discuss with them in these barazas is the safety practices that they must undertake while doing these activities, whether you're doing the roofing, the building works. So we are trying to create that awareness and sensitization in that case. And I believe many of us in the formal sector, in your dotted lines with the informal sector, if we all put energies, combine and try to accommodate the informal sector in this way, we can try to make a contribution to the informal sector in this kind of discussion that we're talking about.
All right, thank you, Frank.
Yeah.
We can move on to Mr. Nation to give us a perspective. What did you pick out? What question was directed and what response?
Yeah, I think I will just add up, or if I think it was answered, but I will just add up on the how do we accommodate the informal sector with regard to also how does effective leadership look to them, because they don't have organized way of working. And I'll do this with the example that I personally invoked in the SME's engagement toward compliance. So basically, starting with the leadership, always like the normal way you do to the corporate organization and the formal sector, you will always secure at any cost the buying from top. So even those informal sectors, maybe the entrepreneurs, even they have some level of institutional kind of way they work. Like he mentioned, different associations, different unions at their level and the groups. So if you secure buying from their level of authority that they do bow under, that's the very key. And also engage them as enough as possible. And for this point, I will call, I think, I will argue everyone who is here. I like the point that we were supposed to also have the same forum with them in the room. They are not that much engaged, but I would assure you, the private sector, Tanzania being one of the examples, private sector is doing a lot in terms of engaging them, the NGOs and the other organizations. They only lack the technical part, which is like the safety component. I remember to have involved in one of the projects where we reached more than 600 SMEs that we are doing like informal production in agriculture, mechanical and the rest. And now they reach to the level that they are properly trading locally, but they want to do exporting, but their level of compliance, you know, if we start international trading, now compliance is non-negotiable, the issue of standards, health and safety and the environment. So some of the NGOs engaged us in the level of ensuring we drive that level of culture from those small leaders. And I can assure you the awareness level is still low, and the technical personnel, I think we are so many, but we are not properly reaching them out. I've not have spoken with different officials from OSHA, where in the Department of Promotion, they are really calling for OHS professionals, not necessarily waiting to be paid, but to voluntarily going out and putting this kind of awareness. That's the way that we can secure buying from those levels. So
all right.
That's what I
All right, thank you, Nation. We go on to Joseph. Let's rush it as we wind it, as we answer these questions, because now we are getting into people's mindset for lunch. And I'm sure they're about to switch off, but give us a few minutes. Right after this, we are heading into our lunch. I'm sure the coupons are already a big sign, so hang in there and let's keep up until we finish this session.
All right, thank you, MC. So, unfortunately, I didn't pick the name of the gentleman that raised the questions, but beginning from the first question that was talking about the incentivization program for contractors, it is actually beyond recognition and rewards for us. As I said, our staff or our human capital is the greatest asset we have. And our operations are much dependent on them. So as part of incentives and beginning from well-being, just like to make sure our minds and bodies are healthy, we have a gym at our workspace. And our contractors are part of the staff that use that gym. As long as you are part of them, you go in, you exercise to maintain your health and well-being of the body and of the mind. That's one. Second one, we recognize them. I mentioned earlier that on a monthly basis, we recognize people who have performed well in safety. No matter how small the impact of what you've done is, we recognize you. And contractors are part of them. In fact, in October every year, there is a week where we celebrate health and safety internally, leave alone the one we do in April on the national and international level. And in that week, every section is recognized as, they give us, or they identify who has performed or outperformed others in health and safety, and they are rewarded and recognized. So each contractor that is on site participates in that reward program. Then we have what we call a capacity building as a form of incentive. What is it? When you're coming to do work as a contractor, we don't only look at productivity. As we said, there is nothing that can be done unless it is safe, and that is our slogan. So the budget that we give you as a contractor has safety aspect fully 100% catered for. That implies that everyone you have on site should do everything day in, day out, as safe as possible. You don't know what that actually means to people. As someone new who has come into site, and on the outside, in the informal sector, things have actually been done the other way around, as we've been explaining. So it is a learning point, but also a very good incentive system. The other incentive system is the trainings. We don't only train our staff as UBL. We go ahead and train our contractors free of charge to make sure that the capabilities are really high and up to standard for them to appreciate as much as possible everything in safety. They are represented on every engagement platform. They are very well represented. So that gives them an opportunity to share their concerns, to follow up on actions that they have raised before, and also bring on board new ideas. So that is part of it. Let me go through quickly the second segment of the question, which is talking about the human impact or human judgment impact in automated processes. So the first question you should ask yourself is, what is the risk benefit of automating and not automating? Where will you face the most catastrophic health and safety incidents? You can begin from that point. If automation is the yes, then you go for it. If manual activities are a yes, then you can wait and learn by experience. But so to control the impact of human complacency in automated processes, we begin with sharing incident alerts, beginning from near misses. A near miss is a learning point. So when we have our colleagues in Kenya, KBR, and then Tanzania, Serengeti, so when an incident happens on any of those sites, it is shared across with clear actions related to that process, activity, or incident. So that provides an opportunity on the site for you to go and reassess, reevaluate the way you perform that activity. If there is a gap, you will pick it there and then, and you control it. Secondly, we do integrity checks, audits, and inspections of those processes on a monthly basis. Then the last one is that there is a proper program for asset care management. It entails a lot, but it keeps our assets very good in performance. Thank you very much.
Thank you so much. Let's go straight to EACOSH Uganda.
Thank you so much. Now, interestingly, there was no question directed directly to me, but in addition to all that has been said, I just wanted to comment on two other issues which have been talked about still. Effective leadership in the informal sector. Of course, we haven't yet implemented it in Uganda effectively, but what I would envisage as effective leadership, because the informal sector doesn't have the kind of setup that we have in the formal sector, where we have a leader that you can call to task to explain certain systems. We are looking to draw on the experiences of our colleagues who have talked of having the people organized in groups, circles, associations, and things like that, so that you can reach your message out to them well. My emphasis in this regard is that these chairpersons of these associations and groups and circles may not have as much authority or power, maybe I could be wrong, as say a CEO of a factory or a certain organized workplace. So I am thinking we need to now again still talk about the leaders, their mindsets, so that they serve as champions. They set the example for their fellow, say, border riders at that stage, because he might not be able to force his colleagues to do something, but then if they watch his behavior and his behavior is exemplary, then they would follow suit. So we need to target these champions, identify those you feel have influence over their peers, so that we can use them now to spread the occupational safety and health message. Of course, we have to build relationships instead of trying to be the ones that are bearing the whip. Then I also wanted to add my voice to the aspect of corporate social responsibility, which was asked in regard to ensuring safety of the communities that we operate in. My addition is that our corporate social responsibility efforts should not be what the company feels they want to do for the community, but in these engagements that you have with the communities, you pick what it is their pain point, and let our corporate social responsibility actions be addressing those issues, because we have seen companies which are operating in communities and they are giving out schools, they are building schools, they are giving out certain staff, giving out staff to the community, and yet the community is complaining that this company, this organization is making noise for us, is polluting our water source. So we need to target our interventions for the community in the direction that the community needs these interventions.
All right, great.
I thank you very much.
All right, we'd like to give a round of applause for our speakers today. And as we wind up on this session, I would like to do a quick recognition of a few practitioners here that I've been seeing around doing much of the great works. Maybe, I don't know, I'd seen around Nicodemus that has been so much leveraging the future of Uganda through university interactions, looking at, I think I've seen the initiatives in Makerere University and Chambogo University with the clinics that is building the future of safety. I think, and I've also seen some campaigns on road transport from, I think, Gloria, so which have been like really going on great. We appreciate our roads are now safer with your activations and campaigns. I don't know where Ronald has gone, but I've seen Ronald Bete pushing a lot of engagements, talk shows, host different practitioners to come and speak and push much more onto health and safety. And I think I've also seen Brian Ahimbisiwe, who serves on the Regional Psychosocial Support and represented us in the US on the International Day for Mental Health, talking about workplace safety in Africa and the perspective how we can actually change it under the Voice of America. So I cannot mention as much. We have all been doing great in our capacities, but I just wanted to say that we see you. Those who are pushing these concepts, those who are pushing these awareness programs, we see you. The government sees you, and that's why they are pushing so much for private-public partnerships. I would like to also ask the panel team to stand up here for a group photo. So the photographer should be close by. We take a group photo and then we head in for lunch. But as we wait for lunch on the International Day for Mental Health, which is 10th of October, we have the first Occupational Health and Safety Golf Tournament that seeks for psychosocial support for workers. And I'm proud to say that SHAU was one of our first support partners. But of course, the Ministry of Gender, Labor and Social Development, who endorsed as well. And we were supposed to have the ILO representative, and I managed to reach out during the break, and Mr. Karen Kimati Molaga has sent her regards. She couldn't make it, and but she is with us, and she says that Uganda is at heart in regards to pushing occupational health and safety, and the ILO can always come in one way or the other if time can allow. So I would like us to have a group photo here. Was it?
Hello?
And number two is because it is giving us the reforms in terms of sector reforms that we are all envisioning out of this session. One of the things that they have spoken about is messaging need to change. The other thing is informal sector inclusion. And the third thing is political and technical lobby. Thank you very much. And the last but not least is about CSR. So what we'll be doing after this session, remember this is a special session we had talked about, is we will tomorrow have a call to action around the 3-4 reforms that we have discussed. And we are happy to be represented by Kenya and Uganda, and this we will follow through. So with that, allow us to take a very beautiful photo.
The
for
photographer
our
who is taking the photo, I don't see the camera guy. Let's do this faster.
So as they're taking that photo, allow me to make a few announcements. One of the very key announcements is to request our members, colleagues, to walk around the booths. Please find time to see the wonderful things the booth exhibitors are showing, and also to appreciate the work that has been done by our wonderful exhibitors. So please find time during the breaks to walk around. The other announcement is that we are expecting the minister at 3 p.m., meaning that your lunch break is shorter, and acknowledging that in the military that you usually get seated before your boss comes in. We anticipate all of you to be seated 10 minutes before 3. So allow us to very fast go through lunch. You have lunch vouchers that have Royal as a restaurant and another one that has a TT. So the ones who have a voucher written Royal will go to the Royal restaurant. The one that have a voucher written TT on top there, they will go to the TT restaurant. We will have some of the organizing committees direct you to the respective restaurants. Please enjoy your lunch, and I'll come to remind you who has paid for that lunch. Thank you very much.
So the TT restaurant is the one on the left of the reception. The Royal restaurant is the one adjacent to the hall. It's just in front of the lounge. Yes, it has Royal restaurant. So kindly check your ticket so that you go to the right restaurant. Thank you. Enjoy your lunch. As I pray for it, Father, in the name of Jesus, we thank you for this lunch. May it go where it's supposed to go, and we eat it very quickly and come back here 10 minutes to 3. In Jesus' name we've prayed. Amen. Your properties, kindly, you can take the essential ones with you. If you don't have a lunch coupon, kindly come and see me. I give you a lunch coupon.
You've seen the vision, you've felt the scale of what's coming. Kawalega Petrol-based Industrial Park is open for business, and your expression of interest will be your first step in. Before the window opens, get ready. Visit the KIP Investor Portal at kip.unoc.com and download your free Expression of Interest Investor Guide with everything you need to prepare in one place. Your company documentation, your project details, your track record, your commitment to Uganda, all laid out step by step. Have a question before you begin? Reach our investor relations team at support.kip@unoc.com for any support. Invest in KIP, invest in Uganda. Kawalega Petrol-based Industrial Park, a project by the Uganda National Oil Company, UNOC. You've seen the vision, you've felt the scale of what's coming. Kawalega Petrol-based Industrial Park is open for business, and your expression of interest will be your first step in. Before the window opens, get ready. Visit the KIP Investor Portal at kip.unoc.com and download your free Expression of Interest Investor Guide with everything you need to prepare in one place. Your company documentation, your project details, your track record, your commitment to Uganda, all laid out step by step. Have a question before you begin? Reach our investor relations team at support.kip@unoc.com for any support. Invest in KIP, invest in Uganda. Kawalega Petrol-based Industrial Park, a project by the Uganda National Oil Company, UNOC.
the years, we have created unforgettable moments of glitz, glamour, and professionalism. We have ignited change, birthed game-changing solutions, and celebrated excellence in health, safety, sustainability, and environmental landscape. And now, AfriSave is back, bigger than ever.
In a world where progress and infrastructure development is constant, there is a need to strike a balance to adhere to the principles of sustainable development. Geotropic Consults is an environment and social safeguards practice incorporated in Uganda since 2014. And it's our core mandate to ensure that as we execute services for our clients, we ensure that the people who work for us and with us, the communities within which we operate, and the environment are safeguarded.
We operate in 5 major core areas, and first core area is environmental management, and that's where we do impact assessments, that's where we do audits, that's where we do social baselines. The other core area that we operate in is in terms of planning and policy, and that's where we do feasibility studies and baselines and ensuring that we characterize the environment and the receptors are really taken care of in terms of ensuring that we have appropriate mitigation measures. And the third area that we work in is health and safety. A health environment and a secure environment, both for people, but then also the people that at the workplace is very, very critical. And we support our clientele to ensure that health and safety is at the heart of everything that we do. We do also support our clientele in terms of ensuring ISO training and preparing the requisite plans and policies and procedures and documentation for our clientele to be able to secure certification, for example, health and safety, environment management, and quality standards. Last but not least, we are into policy, research, and advocacy. We do a lot of research in terms of agriculture, in terms of education, extension to inform intervention, to inform change, to inform policy. That's also an area that we have worked with our clientele, both national and international level. Importantly, we draw on a critical mass of researchers and associates, both within Geotropic, but also in academia, both at national level, but also at national level, to be able to tailor and come up with appropriate solutions and products and services to our clientele.
We are also members of the UN Global Compact, where we espouse the principles of sustainability. We have been able to offer services in the entire energy sector. Talk about generation, transmission, and distribution. We've been able to offer services in that subsector, and more recently, we've been involved and are continuing to get involved in activities in the oil and gas space in Uganda. Geotropic Consults calls upon you to continue working with us for a sustainable future.
Hello, colleagues from the East African Community Occupational Safety and Health Conference. My name is Maria Mandu and I am the Social Development Manager at NEBOSH based in the UK. The National Examination Board in Occupational Safety and Health is an organisation that runs a number of qualifications internationally in health, safety, well-being and environment. I am devastated that I cannot make the day today, but I hope that this short speech will show our support for the conference as well as some of the fantastic initiatives that we are doing through the Social Purpose Programme. Our Social Purpose Programme is designed to give back to the world of occupational safety and health. We have over 25 projects running in 11 countries, and we are so pleased to support initiatives in Africa and specifically Uganda. The number of activities that we have in Africa is increasing. We have a women's PPE project based in Nigeria. We have a deaf awareness and health and safety training program in Kenya. And we also have an artisanal and small-scale mining project going on in Zimbabwe and Uganda. The results for these initiatives have been fantastic. We have managed to reach collectively over 75,000 indirect beneficiaries across the full program across the world. The initiative in Uganda has really picked up in terms of artisanal and small-scale mining, identifying new ways in which we can be safer and encouraging small mining to be a safe practice. We support those projects for people who cannot advocate for themselves, particularly in the informal working sector, and we really champion the work that is going on in Africa and particularly East Africa. We are keen to support projects in East Africa and we welcome expressions of interest when our window of opportunity opens for funding, which will be next April. I would be very, very pleased to speak to anybody that would be interested in supporting our social purpose programme. I wish you a very good conference and a really great day, and apologies I couldn't be there again, but know that NEBOSH support this initiative and I hope that the conference goes really well. Thank you and goodbye.
You've seen the vision, you've felt the scale of what's coming. Kawalega Petrol-based Industrial Park is open for business, and your expression of interest will be your first step in. Before the window opens, get ready. Visit the KIP Investor Portal at kip.unoc.com and download your free expression of interest investor guide with everything you need to prepare in one place. Your company documentation, your project details, your track record, your commitment to Uganda, all laid out step by step. Have a question before you begin? Reach our investor relations team at support.kip@unoc.com for any support. Invest in KIP, invest in Uganda. Kawalega Petrol-based Industrial Park, a project by the Uganda National Oil Company, UNOC.
Hello, colleagues from the East African Community Occupational Safety and Health Conference. My name is Maria Mandu and I am the Social Development Manager at NEBOSH based in the UK. The National Examination Board in Occupational Safety and Health is an organisation that runs a number of qualifications internationally in health, safety, well-being and environment. I am devastated that I cannot make the day today, but I hope that this short speech will show our support for the conference as well as some of the fantastic initiatives that we are doing through the Social Purpose Programme. Our Social Purpose Programme is designed to give back to the world of occupational safety and health. We have over 25 projects running in 11 countries, and we are so pleased to support initiatives in Africa and specifically Uganda. The number of activities that we have in Africa is increasing. We have a women's PPE project based in Nigeria. We have a deaf awareness and health and safety training program in Kenya. And we also have an artisanal and small-scale mining project going on in Zimbabwe and Uganda. The results for these initiatives have been fantastic. We have managed to reach collectively over 75,000 indirect beneficiaries across the full program across the world. The initiative in Uganda has really picked up in terms of artisanal and small-scale mining, identifying new ways in which we can be safer and encouraging small mining to be a safe practice. We support those projects for people who cannot advocate for themselves, particularly
Over the years, we have created unforgettable moments of glitz, glamour, and professionalism. We have ignited change, bettered game-changing solutions, and celebrated excellence in health, safety, sustainability, and environmental landscape. And now, AfriSave is back, bigger than ever.
In a world where progress and infrastructure development is constant, there is a need to strike a balance to adhere to the principles of sustainable development. Geotropic Consults is an environment and social safeguards practice incorporated in Uganda since 2014. And it's our core mandate to ensure that as we execute services for our clients, we ensure that the people who work for us and with us, the communities within which we operate, and the environment are safeguarded.
We operate in 5 major core areas, and first core area is environmental management, and that's where we do impact assessments, that's where we do audits, that's where we do social baselines. The other core area that we operate in is in terms of planning and policy, and that's where we do feasibility studies and baselines and ensuring that we characterize the environment and the receptors are really taken care of in terms of ensuring that we have appropriate mitigation measures.
Nange mwebale mwebale abalungi mwebale fenna betwalaba abagenyi twabalamusa mwenna fenna betwalaba abagenyi twabalamusa abalungi mwebale fenna betwalaba abagenyi olwaleero olunaku lw'amaanyi fenna betwalaba abagenyi ne minisita naye yatuuka fenna betwalaba abagenyi laba abaami ab'ebbeeyi fenna betwalaba abagenyi waliwo abakyala bambadde ebitiibwa fenna betwalaba abagenyi twabalamusa mwenna benna betwalaba abagenyi yadde mutumye emmere bannange benna betwalaba abagenyi twabalamusa mwenna benna betwalaba abagenyi olwaleero olunaku lwa bbeeyi wololo nimbasakanye eddoboozi lya gono abange wololo twabalamusa mwenna twabalamusa mwenna owange neyanze olunaku lw'amaanyi owange wololo mwali kabaka mwali mama wololo mwali alamula empologoma ensajja benna betwalaba abagenyi twabalamusa mwenna benna betwalaba abagenyi twabalamusa mwenna benna betwalaba abagenyi twabalamusa mwenna benna betwalaba abagenyi twabalamusa mwebale wolo mwebale abalungi mwebale mama ne minisita yaye yatuuka twalamusa mwenna twabalamusa wololo abalungi mwebale wololo twabalamusa mwenna owange ligenda nabedda twabalamusa mwenna wololo mwebale abalungi mwebale mama wololo eno yebuladde banange gyowulira ne minisita naye yatuuka wolololo mwebale banange mwebale mama twabalamusa mwenna mama ndigenda nabedda baliwo abalenzi abazamba ebitiibwa wololo balungi mwebale tweyanze banange tweyanze mama ndigenda n'abaana mwebale banange mwebale wololo twabalamusa mwenna twabalamusa abalungi abagalwa wololo twabalamusa mwenna mama ndigenda n'abaliwo biriwo ebirenze ebisamba byendaba wololo twabalamusa mwenna nabe twalaba abagenyi twabalamusa mwenna wololololo mumpe ku ngalo abalungi abagalwa mama owange yongeze engoma njulire sebo owange yongeze engoma njulire sebo bena betwalaba abagenyi owange owaddabo konda benze wololo eno ebuladde banange gyowulira bena betwalaba twabalamusa mwenna bena betwalaba abagenyi twabalamusa mwenna wololo twabalamusa mwenna awange wololo ne minisita naye yatuuka neyanze biriwo ebirenze ebisamba byendaba owange wololo olwaleero omukolo gw'amaanyi wololololo mwebale banange mwebale mama mwebale abalenzi abawano wololo ndigenda n'abaliwo jano tumukundu omuzeeyi banange naye atuuse banange twabalamusa mwenna owange abagenyi abalungi ab'ebbeeyi mama ne minisita naye yatuuka wololololo ne minisita naye yatuuka twabalamusa mwenna neyanze banange neyanze olwaleero olunaku lwa bbeeyi twabalamusa abalungi abagalwa owange ndigenda n'abaliwo ebireze byendaba mama twabalamusa mwenna ndigenda n'abaliwo twabalamusa abalungi mwebale twabalamusa owange ndigenda n'abedda twabalamusa abalungi abagalwa owange eno yebuladde banange gyowulira ndigenda n'abaliwo mwebale banange mwebale ye ye mwebale abalungi mwebale owange ndigenda n'abaliwo owange ndigenda n'abaana twabalamusa banange mwebale ye ye owange ndigenda n'abaliwo twabalamusa banange mwebale mama mama ne minisita naye yatuuse owange ndigenda n'abaliwo ku lunaku olw'ebbeeyi olulungi bwe luti maama abakyala n'abaami mwebale okujja abanga b'ebitiibwa owange walala olwaleero omukolo gw'amaanyi ffenna be twalaba abagenyi twabalamusa mwenna ndigenda n'abaliwo mwebale banange mwebale wololololo ab'e Kenya banange mwebale ololo ndigenda n'abaliwo ab'e Uganda banange mwebale ffenna be twalaba abagenyi twabalamusa mwenna wololololo twabalamusa mwenna ndigenda n'abedda mwebale banange mwebale wololololo eno yebulade banange gy'owulira mama mama twabalamusa balungi abagalwa twabalamusa ndigenda n'abaliwo wololololo twabalamusa ndigenda n'abaliwo mwebale okujja abanga b'ebitiibwa wololo mwebale okujja abanga bagalwa wulira mama ndigenda n'abaliwo mwebale okujja abanga bagalwa wulira mwebale banange mwebale ololololo mwebale banange mwebale mwebale banange mwebale ololololo wololo owange 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 wange twabalamusa abalungi abagalwa ffenna be twalaba abagenyi twabalamusa abalungi abagalwa kujja abagenyi mwebale mwebale okujja abanga b'ebitiibwa kujja abagenyi mwebale mwebale okujja kujja abagenyi mwebale mwebale okujja abanga b'Oluganda abagenyi mwebale mwebale okujja abanga b'ebitiibwa kujja abagenyi mwebale mwebale okujja abanga b'ebitiibwa abagenyi mwebale mwebale okujja abanga b'ebitiibwa abagenyi mwebale mwebale okujja abanga b'Oluganda abagenyi mwebale mwebale okujja abanga b'ebitiibwa abagenyi mwebale mwebale okujja abanga b'Oluganda nyaba abagenyi mwebale olwaleero olunaku lwa bbeeyi abagenyi mwebale mwebale okujja abanga b'Oluganda abagenyi mwebale nimbasakanya bange abagenyi mwebale mwebale okujja abanga b'ebitiibwa abagenyi mwebale mwebale okujja abanga b'Oluganda nyaba abagenyi mwebale ne minisita naye yatuuka abagenyi mwebale mwebale okujja abanga b'ebitiibwa abagenyi mwebale mwebale okujja abanga b'Oluganda abagenyi mwebale mwebale okujja abanga b'ebitiibwa era mwebale okujja abanga b'Oluganda abagenyi mwebale mwebale okujja abanga b'Oluganda abagenyi mwebale mwebale okujja abanga b'ebitiibwa wololo mwebale okujja abanga b'Oluganda
Hello?
atamukute agamba yaye kwatira ddala onyeze atamukute agamba kwatira ddala onyeze
Hey, hello.
atamukute agamba kwatira ddala onyeze atamukute agamba kwatira ddala onyeze atamukute agamba kwatira ddala onyeze
All right. All right, give a round of applause to the warm welcome for our chief guest. So I would like us to go on our feet right now as we sing the national anthem that's going to be led by our very own princess, the Princess of Uganda here.
Good afternoon, our esteemed delegates. My name is Davida Shakir Bereket. We are going to sing the Ugandan anthem. O Uganda, may God uphold thee. We lay our future in thy hands. United, free for liberty, together we always stand. O Uganda, the land of freedom, our love and labor we give. For our own dear land, we will always stand the pearl of Africa's crown. Mungu taomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuwajibike, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu. Thank you.
Let's give another round of applause to our princess here for taking us through the anthems. Without wasting much more time, we would like to invite the Commissioner, Occupational Health and Safety Department under the Ministry of Gender, Labor and Social Development to introduce our chief guest. So as the Commissioner is prepping our chief guest, I hope the lunch was amazing. I hope we are all energized and we are ready to listen from our very own Honorable Minister of Gender, Labor and Social Development, duly going to be introduced by the Commissioner, Occupational Health and Safety Department.
Thank you so much, MC. Honorable Minister of Gender, Labor and Social Development, General Henry Tumukunde, representatives of the institutions from our sister countries in the East African community, the presidents of the association from these sister departments and associations in the East African community, practitioners here present, ladies and gentlemen. This afternoon I stand here on behalf of the Permanent Secretary of the Ministry of Gender, Labor and Social Development, Mr. Agre David Chibenge, who unfortunately was not able to join us for this conference, but has delegated me to officiate on his behalf and conveys his warm regards. Honorable Minister, we are very happy to receive you this afternoon, and in the room we have over 100 participants who are representing 5 countries: Eswatini, South Sudan, Somalia, Kenya, and Tanzania. And we are still hopeful that we shall be joined by Rwanda and Burundi, hopefully in the course of the day or by tomorrow. Honorable Minister, This event is proudly sponsored by a number of companies and organizations, many of whom I may not mention in the interest of time, but we have visited their stalls, and we appreciate all the support that they have given us towards making this event a very big success. We thank all the exhibitors who are here with us to showcase what they are doing in terms of health and safety. Honorable Minister, since the morning started, we have had a number of conversations and we continue to engage, and we are looking forward to hearing what it is that government of Uganda has for us this afternoon, and I request that I do not take more of your time. I would like to take this very opportunity to invite you, Honorable Minister General Tumukunde, to officially open this conference. I thank you so much, and you are very welcome, sir.
He deserves a louder round of applause.
Our representatives from the sister East African countries, I have been excused by my boss that I don't have to rush so much, so now I have a bit of time. Can we recognize Eswatini? Let me look at Eswatini. Stand up for recognition. Eswatini. Very good. Please pass our regards to your king. South Sudan, our brothers from South Sudan. Oh, good to see you. Good to see you. Pass our regards to our brothers. Somalia. Oh, they are not here. Then Tanzania. Meshukuru kuwaona. And I'm told you now have a new vice president who is my friend. Please pass my regards to him. Say we are extremely privileged to have him on top of things. He's a very good friend of mine. His Excellency now in the Jembi. Kenya, mtu wetu wa Kenya. Wengine nilikuwa niliwaona wakati wengine. Good to see you. Welcome. You look very fresh. Then, of course, the Ugandan team is big. We can't have everybody stand up. Now, first of all, I want to tell you that we are extremely to receive you here, our visitors. Thank you for being with us on this very, very important matter that has got to do with our people who provide labor and who provide professional services, and therefore the subject of making sure that they are very taken care of when it comes to their health and safety. Permanent secretaries and senior government officials, the chief executive officers here present, our social partners, the employers and workers, please always be grateful to people who sponsor you. That's why I had to take photographs with everybody. And next time around, we want more sponsors. Please pass the message that I'm the one in charge now, so since I know most of them, they should give us sponsorship. The President, Executive Committee, and members of the Safety and Health Association of Uganda, please stand up for recognition. I met one of you. And then the executive representative from Tanzania, Occupational Health and Safety Association, TOHASA. And nimefurahi kuona mama. You look like my sisters, you know. And then the distinguished, and of course the Kenyan senior person I met before I came here. Nashukuru kuona. I think he's a commissioner in the Kenyan ministry. Ladies and gentlemen, a very good afternoon. My apologies, should have been the morning, but we had a session of another round of things that we had. It gives me great pleasure to welcome you to Uganda for this inaugural East African Community Occupational Safety and Health Conference. The two-day conference, themed Building Resilient and Inclusive Workplaces, OSH for Formal and Informal Economies, comes at an important time for East Africa as our economies are rapidly growing and transforming. As a country, we have embarked on an ambitious tenfold economic growth journey with global reports indicating Uganda's sustained economic growth of 5 to 6% per year, driven by agriculture, services, a growing industrial sector, as well as a youthful population of 45 point, I think this is the whole population of Uganda, but 72% of this, with a labor force of 13.429 million workers. These are records we've got from Uganda Bureau of Statistics. The African Development Bank confirms East Africa as the fastest growing region in Africa. I think you should clap for yourselves. Of course, we are also harmonized by same language, same general kind of people. That's why you can always go to Tanzania and speak a language and they will understand you. Go to Kenya, speak a Ugandan language and they understand you. So, African Development Bank confirms East Africa as the fast growing region in Africa, which presents both opportunities for unprecedented growth as well as challenges in terms of generating decent employment. That's an important point. As industrialization and technological advancement alter the workplaces as we previously knew it, the ever-changing employment dynamics create unprecedented opportunities as well as emerging OSH risks. The International Labour Organization estimates over 395 million work-related injuries and over 3 million work-related deaths annually, resulting in 4% of GDP loss globally. That's very big. I think we need to work hard to address this. Uganda, over the first 5 years, has been intentional in addressing OSH issues with a focus on workplace registration, inspection, and awareness creation, all aimed at promoting OSH compliance. The rate of workplaces registered and inspections have grown from less than 900 inspections per year in 2020 to over 1,000 in 2025, still very small, despite the dwindling number of inspectors. The workplaces registered have also increased from 500 workplaces per year to over 1,800 workplaces registered in 2025. I don't know if this is very accurate. In the last financial year alone, over 4,000 workers, employers, members of the general public were sensitized about OSH through targeted training, OSH posters, radio, television, and social media campaigns. Where are my media people? I had some arrangement with them yesterday. Wako hapa? They didn't come today. Okay then, unfortunately, Uganda's official baseline of OSH injuries and accidents is still underway to document the national OSH profile, which will detail the available OSH competencies and Uganda current OSH performance. As a region, we must be intentional in keeping OSH at the heart of our development agenda because the engine that drives national economies, the workforce, is critical if we are to have productive and healthy economies. Every worker, regardless of sector, occupation, or status, deserve to work in an environment that protects their dignity, health, and well-being, and life, of course. Each East African state must reflect the conference's theme by implementing OSH promotion measures in both formal and informal sectors. Through the tripartite structures, since over 80% of East Africa's population earn their livelihoods through informal work, locally referred to as juakali, whereas it provides a temporary cushion against unemployment, presents limitations in regard to government tax revenues and work protection as the workers face significant occupational risks with limited access to health services, social protection, and safety resources. Government efforts to promote OSH must therefore go beyond a formal setting and respond to the realities of workers across the entire economy in promoting this fundamental human right of every worker. I must emphasize that regional cooperation will be essential in strengthening our policies and institutions, as well as promoting consistent worker protection standards across the East African community. These my people write a lot of literature. Hosting the inaugural East African OSH Conference 2026 is therefore our declaration that Uganda is committed to curbing work-related injuries and ill health. We call upon all stakeholders in the region to come and on board and put the necessary time, resources, and commitment to make decent work a reality for all workers in East Africa. I encourage our young professionals and emerging leaders to take active role in shaping the future of occupational health and safety in the region. Bring your innovative ideas, your voices heard, build necessary networks, and play an active part in sharing your knowledge, skills, and partnership so as to influence workplaces for improved OSH performance. The government of Uganda is committed to providing public safety and well-being of the people of Uganda, and will continue to mobilize the necessary resources and ensure required policy environment for OSH promotion. I conclude by reiterating the fact that as a nation, we treasure our workforce and we are ready to partner with other stakeholders in Uganda and within the region as we together devise all possible means to create decent employment for our youthful population. I therefore commend the Safety and Health Association of Uganda, my kudos, and its regional partners for this initiative in convening this important forum. On behalf of the government of Uganda, I say to all these delegates, speakers, exhibitors, and partners, karibuni Uganda, asanteni kwa kuchagua kuja Kampala, furahini muda wenu hapa nasi. People are attempting on Swahili, impressive. I say all this for God and my country. Maybe
a very big round of applause for our guest speaker.
Maybe a few points that I can give off the cuff. First of all, I one time attended a China strategy meeting. If you see how much they know about East Africa, how you are a common language, common type of people, the crossing of interests, even in ethnicity and cultural similarities, is something we the East Africans don't seem to know. You can also tell how we are now being interdependent. Look at the road networks, the rail networks coming up, very ambitious programs. The other day I heard the Ethiopians are also trying to open a route to the Red Sea through South Sudan and then connecting to Uganda. There is quite a lot in motion. We are a common people, we look alike, we speak the same language, and we all speak one language, by the way, when it comes to official language, apart from bits of French, but also which is also now adopting the English language. But I want also to remind you that, for example, in our case of Uganda, we have 5.5 million Ugandans. They are neither in employment, neither in any training, and they are neither in any form of education. Whereas indeed you are worried about the safety of those who have work, I want also to open your eyes as you go back to your different capitals on having to look up these people, and we try to give them sufficient attention. Of course, there is also the other fundamentals. We need to start shaping the budget. Yesterday I was talking to Parliament, and I said we may have to start shaping budget according to earnings. For example, my ministry earns quite a bit. I would want to expect a budget that also reflects the same. But also, most importantly, we may have to start attaching demography to the budget, ratios. The number of people in a country should attract programs and budget targets that are, equal to the number of people in these different countries. East Africa, as you have heard, is a swift developing area. We have quite a lot of resources most people don't seem to have. We have the ocean, we have the lakes, we have, sufficient rainfall despite some of the times when we are a bit dry. And of course, a very, very progressive population. I was talking to a Saudi man who imports labor from these regions. He said East Africa provides one of the best compared to Philippines and Bangladesh. So you can give yourself a bit of kudos on this matter. But still, we need to focus on our merits while doing hard enough to make sure that we remain ahead of others. So please pass on our regards to everybody in your own hometowns, and please enjoy Uganda as it can be. Uganda, we now market Kampala as an entertainment city. For some of you, I see you are quite young. You be sure that you explore the nightclubs of the town and many other ventures. And Uganda is safe, don't you worry. There will not be any issues. But they are also very socially active. So that marks the end of my remarks.
Let's give another round of applause to our Honorable Minister.
Maybe I should thank the sponsors. Please clap for them, the sponsors. Thank you very much. And thank Madame Katusabe and her group for doing a very
big round of applause to Dosh.
I think finally let me have a picture with the senior people of the different areas here so that we can take advantage of this very colorful scenery. Thank you very much.
All right then, let's give another round of applause to the Honorable General Minister. So on this we are going to have, all right, we shall have a program on how we are doing this. So we shall start with SHAU leadership to take a quick snapshot with the General. So you've had WASPAC, please rush. As you've had, we are on a firing squad, so it has to be as fast as possible. Please, let's be close by. Tohadsa leadership should be close by. You're a team from Tohasa. Tanzania. Iko wapi? How about this? Okay. The organizing committee, be close by. All right, let's have Southern Sudan. Let's have Southern Sudan first. The organizing committee can hold on for now. Yeah, you can come close by. Southern Sudan and Eswatini should be close by. Eswatini can get close by. Well, you've parted with a gift. Nice. Other countries. Probably our Kenyans have learned. Eswatini, please. All right, Eswatini. Probably they will bring you a gift from the king. All right, Dosh Kenya. Dosh Kenya. Go. No. Dosh Uganda, then organizing committee. What you mean? Guys are bigger than me. And for sponsors, of course. All right, Dosh Uganda. Dosh Uganda, please. Dosh Uganda, there's a big team here. Please run to the front. The picture will leave you. Yeah? And when we are doing the report and we don't see you with the minister, you were not here. You were not here, I'm telling you. Yeah. Organizing committee. And the sponsors should be ready. Yeah, maybe they can extend a bit in front so that they can be able to fit. Organizing committee, please. You have to be seen. Otherwise, you did not organize this event. Where are the sponsors? Are the sponsors ready? Okay, those who have colors, the minister has a thing for our content. Yeah, those with some African beat, some culture. Sponsors, please be coming ahead. Come on. There is a gentleman coming on. Give him, yeah. Okay. Yeah. Okay. Are the partners here? Sponsors, sorry. All right, sponsors, come on. And our princess can be getting close by with amazing voice that took us through the national and East African anthem. All right, labor officers, be close by. Labor officers. We are having one with the princess. All right, let me help you up. All right, labor workers, please, labor officers. Labor officers. And of course, the last but not least, the MCs, the esteemed MCs, please come ahead. Why not? All right, thank you very much, General, Honorable Minister, for your time and being able to be here to take pictures with all of us. We very, very much appreciate your presence. So now we are going on to the next session, which is the panel discussion. And Lucy will be taking us through that program.
I think that was a beautiful session in regards to key opening session. Thank you very much, Honorable Minister. And also we thank you for your time that you've given us today. We don't take it for granted that you've accorded us your time to be here. And now we want to start off with the afternoon session. And we will start off with a panel discussion. And the discussion will be focusing on Vision Zero. You remember we started the conversation in the morning where we are moving beyond compliance. And now we want to have a discussion, and it will be chaired by one and only Mr. Justus Bosire Nyakego. We will also allow him to invite his panelists. So please join me in welcoming him to the podium. It doesn't look like an afternoon after lunch club. Thank you very much. Okay. And the session is also co-chaired by one and only President Tohasa, Madam Caroline, who will help DOSH Kenya with the conversations. And they will help us invite others. So I want them to activate their mics. As they're activating their mics, the title of the session is Vision Zero Operationalization in the Informal Sector. Thank you, Honorable Minister. You've called it out as it should be. And OSH in emerging small and medium enterprises and emerging industries. That will be our discussion for the session. Over to you, Mr. Justus, and take us through the session. Thank you very much.
Thank you very much, Chair, for that opportunity. This is a session that is supposed to take us to the situation where we have our SMEs. In Kenya, we call them the Jua Kali sector, small and medium and micro enterprises. In Tanzania, I don't know how you call them. My colleague, what do you call them in Tanzania? In Uganda, how do you call them? The small and micro enterprises, how do you call them? Is there a special name? The border and the like? They call them Juakali just like Kenya and other names. But majorly in Kenya we call them Juakali. Sudan, how do you call them? Do you have a special name for small and micro entrepreneurs in Sudan? Anybody? Sudanese? Eswatini? How do you call them? You don't have a name. Maybe they don't feature very well in those countries, but in our country, Kenya, they command the lion's share of our economy, and we regard them quite a lot. In this session, we are going to see how we are going to put our heads together to make sure that we bring them on board in the occupational safety and health services, so that as they support our economy, like in Kenya, they do support a big chunk of the economy, we will have them safe and healthy, so that they can even bring more to our economy than anything else. And I wish to maybe allow my colleague to comment before we proceed.
Okay, thank you very much, Chair. Maybe just lightly on Vision Zero, as it was presented before by Mr. Alex. Vision Zero provides an important principle: workplace death, injuries, and ill health should not be accepted as an inevitable cost of economic activities. Yet, operationalizing Vision Zero in East Africa presents a particular challenge because a substantial proportion of economic activities occur within informal enterprises and small and emerging businesses. So now I want our chair to welcome our panelists, so then we can start directly to our discussions. Thank you.
I would wish to invite the MC maybe to call our panelists so that they join us here in front.
Our honorable chief guest, besides implementing safety, we also do a bit of writing. And this session, we want to do 2 paper presentations that will take 10 minutes each. And allow me to invite Mr. Ivan, and he'll be presenting on knowledge, attitudes, practices, and factors associated with personal protective equipment used among coffee processing factory workers in Kimbinge sub-county, Bukoma, Simbi district, Uganda. I hope I have not butchered those names. Thank you. Please go ahead with your paper. In case you're more comfortable standing, please go ahead.
Good afternoon, everyone. I was expecting a presentation to be shared rather than a paper, but I don't know. I shared. I don't know. Sorry.
Could you please put up the presentation?
think we can begin with whatever we have.
Yeah.
Because time is not on our side. So I did a study on knowledge, attitudes, and practices on PPE use, and PPE is personal protective equipment among coffee processing factory workers. Yeah, as you know, Uganda is more of becoming a coffee producing country, and coffee is really booming business in Uganda. And this study was conducted in Masaka sub-region, and it's really in Chivinge sub-county, Bukomansimbi district. Just to give you a background, coffee processing involves, first of all, drying the cherries, and then dry processing, because Uganda, we rely on the sun to dry the coffee. We use dry processing whereby coffee is where coffee is processed. So there are a number of emerging coffee processing factories where workers, trained and untrained, engage to really process the coffee. A lot of risks and hazards are emerging as part of this business, which include exposure to organic dust, endotoxins, but also dust, but also it involves heavy carrying of loads such as coffee bags, which can lead to musculoskeletal injuries, but also crashes, head crashes, back pain, and dry processing being the main processing form. It has been a study that was conducted in Tanzania exposed that exposures were greater than 12 milligrams per meter cubed in East African factories, which I hope is the same case for Uganda. So PPE is really the last on the hierarchy, but in most cases it's the most feasible because of the nature of SMEs. Affordability is really not with us because you cannot afford a machine that makes lesser noise. So you intend to use PPE by default. So all those lead to PPE use. But also now going to the study objective. The study objective was really to a CAP. CAP is knowledge, attitudes, and practices. So we assessed knowledge as a composite variable in terms of having many questions. It had like a total of 10 questions. And then we got a mean score for those 10 questions and used it as the cutoff. Those that are above the cutoff quantify or have good PPE use practices. Same for attitudes and same for practices. The sampling was really, we used Kish-Leslie method where we determined the sample size, but also adjusted for design effect, using a design effect of 1.5 to calculate the sample size, and we ended up with a sample size of 158 coffee processing factory workers. Eligible participants included those that had been employed in the factories in the last 6 months, and we excluded administrative staff, but also workers that were able to participate in the study. We reached out to 197 workers that were eligible to participate, but of course 39 were excluded to make up a total of 158 coffee processing factory workers. The mean score for knowledge was 2.35, positive attitude was at an average of 13, but also good practices were at an average score of 5. Analysis was done in Stata to do descriptive analysis, but also multivariate logistic regression, where we where a p-value of less than 0.05 was considered as significant. So who were the coffee processing factory workers? Sorry. 51.3% were permanent workers, as 34% were temporary workers, and 14% were on contract. History of injury or illnesses, 67%, I repeat this, 67% reported a history of work-related injury or illness, and most of them were breathing problems, as you know, the coffee dust and problems of respiration. 29.7% were hearing loss defects, and 24.1% were cuts and wounds. After measuring good practices, those that had good practices accounted for 55.1%, while those with a positive attitude towards PPE use were 51.9%, and those with good knowledge emerged the winners with 66.5%. Knowledge questions included awareness of any PPE policy, and that was the main gap, where 12.0% recorded to having known of any policy on PPE use or OSH related policy. Attitudes towards, here we are. I think we go to slide number, the one of results. Sorry, we continue. Attitudes. Those that perceived work as hazardous and requires PPE were 70.9%, and those that believed PPE use should be compulsory were 74.1%, and those that believed that coffee processing factory workers should wear PPE even without supervision recorded for, okay. I had skipped that part of the demographics, and mainly 72% were males and 27% were females. Age, majority of them were 17 to 27 years, yeah, but also 34% were 28 to 38 years, and the mean age was really 30 years. Education level, majority 60.8% were at secondary level, while at tertiary level we had only 10.1%, and those primary and below, they were 29.1%. I had finished that, and this is where I was completing with that. 38.6% viewed PPE as too expensive relative to its benefits, while most recognized types of PPE were masks, and on review of literature, that was attributed to COVID-19 and how behavior of COVID-19 translated into higher PPE use, mainly the masks, as people got used to them. Gloves were at 69.9%, and protective clothing were at 58.2%, headgear at 57.0%. About that is what I've just explained. 70.3% of the workers self-provide their PPEs. So the coffee processing factory workers don't dare to provide PPE to the coffee processing factory workers, and that is a big gap because the OSH Act of 2006 provides that an employer should provide PPE for their employees. 39.2% had received any formal training on PPE use, while 55.1% achieved the good practice threshold, as I had talked about, that practices and attitudes were measured as a composite variable. Factors associated with good PPE practices. 7 those that had attained tertiary education or university education had 7.8 times the odds of exhibiting higher or good practices of PPE than those that had not attained education at all. So here the comparator is really those that had no education at all. Good PPE, those that had knowledge about good PPE and PPE use were 3.9 times more likely to use PPE or to exhibit good practices of PPE use than those that had poor knowledge of PPE. Yeah, but also temporary workers, those that are employed seasonally or for a short while, exhibited poor, because when you interpret that odd, it's like saying they were 62% less likely to use PPE than those that were permanent workers in the factories. Those that had negative attitudes towards PPE use were 73 times less likely to exhibit good PPE practices than those that really had good attitudes towards PPE. Yeah, so interpretation of the CAP gap, knowledge is not the bottleneck. The real barrier is structural, as we have revealed that 70.3% of the workers provided their own PPE. And you know, in SMEs, when you don't have money really for, because I think the Kiswahili word really is wananchi. Someone who is looking for mere ya lero, and then you're telling them to buy a helmet, to buy gloves, to buy masks. So really it's affordability, the issue. Attitudes were a mediator, because if someone has good knowledge and they have a good attitude, they are likely to exhibit good PPE use practices. Some of the few recommendations and the many that have been given to government of Uganda is really to strengthen enforcement of the OSH Act, as we have seen that employers don't provide PPE to their workers, yeah, but also factory owners and employees should supply. I don't know how best we can forego this, because really monitoring, it takes a lot of monitoring. Yeah, but also district health and labor forces should conduct routine workplace inspections, because one of the questions that we were asking as a complement to our studies, whether they have been inspected, and most, close to 95% had not been really inspected and monitored. Yeah, researchers is really to have a bigger study, as this was a CAP study and focused on one sub-county. It's really to have a larger sample size so as to get generalizable results that can inform policy. I want to thank you.
Thank you very much, Mr. Ivan. And I think numbers don't lie, right? We have moved to data-driven discussions, data-driven decision making. Allow us to invite the second presenter, Sheila Akatukunda. She is the managing consultant of High Flyers International Limited, an environmental, social health, safety, and quality consultant. She holds a BSc in environmental science, technology, and management, and also a Master of Science in conservation, natural resources management, both from Kambogo University, together with NEBOSH IGSC, with quite a number of ISOs. She is also an editor, and I think her profile is quite rich. And today she will be speaking about beyond compliance, embedding occupational safety and health in small and medium enterprises, productivity systems as a foundation for resilience and inclusive workplaces in East Africa. Ladies and gentlemen, with the permission from our guests, chief guests, allow us to welcome Ms. Sheila. Thank you very much.
Thank you very much for this opportunity. Akatkunda Sheila is my name, like I've been introduced. And away from the professional background, I also run a private business. So that's why I'm very passionate about SMEs. And I hope one day my SME will also grow to be big. It's called Sheila's Kitchenettes. I sell kitchenware. So, are the slides up? Well, I think we can proceed. I only have one argument that I need to put across to this audience, and it is embedded in OSH in our SMEs. It says OSH in our SMEs is not a compliance cost. It is what decides whether a business survives its worst day. And that is just the core of what we are going to discuss this afternoon. And the question I want to put across to you all is, how long do you think an SME would have to survive a small fire? If a small fire were to start, how long do you think this SME would have to survive it or to have the business lost completely? The fire masters in the room. Okay. Thank you. So how long does an SME have before a small fire becomes a total loss? Is it 3 to 5 minutes? 45 minutes? How long? This is what we are going to see as we proceed. So what I'm going to cover here is in 6 steps: the compliance trap, the field evidence from the training I conducted, 3 fires in detail, what the law already requires, this has been discussed in detail, repositioning OSH, and the recommendations. So SMEs, they carry the economy and the risk. Someone said, I think the Kenyan panelist said that the SMEs contribute to 80% of the economy in Kenya. That is also true for us. So SMEs generate a large share of employment and output across Uganda, Kenya, Tanzania, and Rwanda, and all the other countries that are represented in the room. The ILO finds this segment marked by limited resources, high informality, and low awareness of safety standards. And this, coupled with thin management, means that a small failure that would have been identified through an inspection goes undressed until it becomes an incident. By the time the failure becomes visible, it's already a loss. And then we need to look at the misreading. These are 2 very different readings of OSH. What the owners think, even in the formal sector, this is what the top management thinks. When you talk about OSH,